sitting next to Christian?
Or Beverly, are you talking to me?
Good morning, everyone. I'll try again. Good morning, everyone. I'm going to invite everyone to take their seats and buckle in. No. We are going to kick off what is hard to believe our, well, I shouldn't jinx it. We think our last JF meeting of this session, and it has been a privilege and an honor to be here with every one of you I'm going to actually start by turning to my good co-chair, Senator Anwar.
Thank you, Madam Co-Chair. Thank you for your leadership. So we are hoping this will be our last JF meeting, but we have just penciled in 29th as well, just to be on the safe side. It's sort of when you plan, you keep the things moving. If this is our last meeting, there are a lot of people, at least we need to thank, but I wanted to start by thanking my amazing co-chair, Representative McCarthy. She is an individual who actually is extremely thorough, detail oriented, and has a systematic approach to things, which is phenomenal gift when you actually have many bills that you actually go through each and every aspect, and she takes notes, which are amazing, because if you have even made a small comment, she has it down in her notes. So it's beautiful. And so that's important, because that becomes relevant when we are writing the bill and improving things. So I wanted to thank you, Madam Co-Chair, and also our ranking members. We have spent more time in the last many weeks, more than we have spent with our families. And believe it or not, we like each other. At least I like them. It's great, because the conversations and the frank conversations we have make the bills better, because there's more than one way to look at things, and that's part of the discussion that we have, and we truly feel that having you as part of the leadership effort is really helpful and great. We are also thankful for our vice chairs with Senator Marks, as well as Senator Julie Kushner and Representative Parker. They are individuals who have brought so much value and so many bills with their expertise, and this has been very helpful. And I also wanted to say that we are only as good as our team, because while we are here talking about bills, we are looking at some of the things. There are individuals who have been working behind the scenes to keep things moving seamlessly. Under the leadership of Beverly Henry, who actually runs one of the most organized, tightest ship in this building, she actually gets things done. When somebody does things very well for a long time, it becomes a reflex. So, and reflexively, she actually has been able to keep things moving and then make sure that we are not missing any deadlines, any meetings. Kate Hamilton, who's been part of our team. Thank you, Kate. You're here as well. Thank you for keeping us organized as well. The bills, each and every document that we are seeing, which are by now with this committee, thousands of pages, it is because of two individuals, and that is our LCOs, Eileen Lawler Parker and Nick Panzarella. Thank you for the work that you do. I actually, whenever I see them, I'm thinking I'm going to diagnose carpal tunnel syndrome, because how can one person have so much work that they're doing and not have carpal tunnel? So I'm always worried about how much work they're doing, and really that's we can have concepts, you can have thoughts, but somebody is putting them together, which is a gift that they have. The OLR, again, with Nicole and James Orlando, Nicole Doobie, they have been able to look at every single testimony, go through the details, and then every comment and things that have been made by people to improve the bill. So we thank you for that as well. And David Kaplan, Dave Ratcliffe, Kathleen Panazza, who actually makes sure that we talk for 3 minutes, and I'm close to those 3 minutes. She may actually just show up. And the CTN, who's been actually making sure that people get to hear, and there's transparency in every aspect is good. The only complaint I have CTN is they cannot make my hair look a little better, but it is what it is. And our intern, Peter Kolakowski, who's been here at 3 a.m., 11 p.m. Every time, and he is one of the last persons to leave, and having intern like that is a blessing. And finally, not necessarily finally, but our entire group of the Public Health Committee members. We have been together for these last many weeks, and we have got to learn so much about each other's thought, and it completes us, it improves us quite a bit. And we thank you for that, for each and everyone who's been part of this effort. And then finally, the public, the people who come and spoke. You made us better human beings. You made us learn about the issues, your lived experiences, and they are more valuable than any piece of paper that one can ever read. So I just wanted to use this opportunity to thank everyone. Sorry, it's a little longer, but so are many of our meetings, but it's worthy to thank everyone for that work that we are doing collectively. So Madam Co-Chair, back to you.
Thank you very much for that, Senator Anwar. And we thought it was good to start our meeting with the thank yous. Sometimes we wait till the end, and I guess you could say save the best for last, but appreciate that, Senator Anwar. Senator Summers.
Yes, good morning, everyone. And I'm not going to repeat everything that my good family member has reiterated here this morning. I just would like to thank the committee members. I know we've had a lot of long hearings. Some of us have stayed here. Others have been online till very late in the morning or early in the morning, late at night. And to the folks who came out to spend their time testifying and submitting written testimony. It's really important. We do read all the written testimony, even if you don't have an opportunity to come and see us in person. You know, I think the Public Health Committee is one of the most important committees we have in the state of Connecticut. It really is one of the committees that intimately touches people's lives. And we hope that we are, crafting legislation that improves healthcare, reduce costs, and really helps Connecticut and its individuals. We will not agree on everything. And I'm hoping we don't need another JF meeting, although this is a very hefty agenda. But I do want to do one shout out to our LCO attorney, who's absolutely been buried with bills that we're doing here today. She's really tried to do all she can, but we keep giving her more and more work. She is a trooper, many hours, and we would not even be where we are at this point without her. So thank you, Eileen. You've done a great job in your team, James and Nicole, etc. And our researchers also do an amazing job to help us. I know Jared and Adam on our side. I'm not sure who's on your side, but they really help all the committee members understand the intricacies of the bills. I'm looking forward to getting through the agenda today. One thing I do want to say about our agenda today is that unfortunately, just because of the volume of bills that we have and the intricacy and the detail of these bills, many of these bills that you're going to hear today are the horrible work in process. I don't like to vote on bills that are work in process, especially at this point in time, because it's late in the season, so to speak, of the session. So if people are voting no today, many of them will be voting no because these are not finished bills, and that many times leaves people uncomfortable with what will go in the bill going forward. So if legislators decide to vote no today, that doesn't mean that they're necessarily against the idea or the concept of the bill. It's just that it's not in its final form, and many of us are uncomfortable with that. I think there's a lot of value in many of the bills that we are hearing today. So I just wanted to make sure that people knew that, who are maybe listening or that are here today in person. So thank you for that. And I'm looking forward to getting started. Thank you.
Thank you for those remarks, Senator Summers. I think that's important and helpful context. Representative Clara DeStitria.
Thank you, Madam Chair. I want to thank everybody for being here today and the support staff that everybody said before me. We couldn't do this without you. I have to thank Adam and Jared, who are there, that keep us in line, that are always, texting us. And I apologize for texting early and late, which does happen often. I have an idea and I don't want to forget it. So thank you for your hard work. Thank you to Eileen. As said before, she shakes her head, can't do it too much. You got to stop. She gives us the timeout. So thank you for all the work that you guys do. I need to thank my counterpart in the Senate, Heather Summers, who has been steadfast in her work in this committee and always, as a first-year ranking member, teaching me what I need to know and being good cop, bad cop sometimes when we need to. I want to thank our co-chairs, Kristen McCarthy-Vahey and Senator Anwar, for your ability. We do basically like each other, but a lot of times we question ourselves, but we do. It's always a work in progress, and there's a lot of give and take, as you heard in this committee. And we're going to try and always make bad bills better and do our best to move these bills forward. So thank you again, everybody. Thank you.
Thank you so much. And I think it's really important that we do that because we are a team And none of this work gets done without the entire team who has been mentioned here today. And I'll add Giovanni and Molly as well to that thanks, but truly to everyone who has been mentioned by Senator Anwar and by the ranking member, Senator Summers and Representative Clara Destetria. I am incredibly grateful and humbled by the learning that we have here before us and that we will continue to have as we continue our, as Senator Summers said, work in progress. I thank you, Senator Anwar, for your generous words. I may not be as effusive always out loud, but I am just incredibly grateful for the privilege to sit here together with all of you. Those of us who are sitting here in the, we say circle, but it's really an oval, and together with all of you who are listening out on CTN and here in the room with us and on Zoom. So with that, we are going to begin our agenda. Moving on to item 3, bills to be considered for JF action. Item number 1, Senate Bill 9. This is an act concerning health and wellness for Connecticut residents. This is a JFS to the floor, LCO number 6420. May I have a motion?
So moved.
Moved by Senator Anwar. Is there a second?
Second.
Seconded by Senator Marks. Senator Anwar, I'm going to turn it over to you.
Thank you so much, Madam Co-Chair. This is a pretty big bill. And so I'll go through many of the sections for benefit of everybody and all the people who are listening. So there are many sections to this. So section 1 is about assisted reproductive technology, ART, which is just in simplistic terms is in vitro fertilization. This bill prohibits anybody from stopping, barring, or creating limitations for in vitro fertilization and the various types of those procedures. So that's one part of the bill, the section 1. Section 2 is about having access in Medicaid to be able to have the coverage for same-day access for long-acting reversible contraceptives, the LARCs. For simplistic terms, the IUDs, whether they are with the hormonal impact or without hormone, and make sure that they're available at the federally qualified healthcare centers. Section 3 is not what you saw in the initial bill, because the previous section 3 that was in the first version of the bill has been removed. That was because the bill would have had to go to judiciary, so we removed that. So the previous section 4 has become section 3 in this bill, and section 3 is about harm reduction centers for substance use disorder, opioid use disorder, and this is talking about opportunity for the state of Connecticut or the opioid settlement fund to be used for wraparound services, counseling, social work support, various responsibilities that we have towards the citizens. Now, in the conversations in the previous time, we had heard about the federal law restricting. So we have actually changed the language in this bill. So the federal law limitations would no longer be applicable in this law. That we are the bill that we are looking at right now. The JFS language has removed the federal concerns that there were. So I wanted to just make sure there's no confusion around that part. And we are going to have DMIS and DPH work together for a pilot program with 3 municipalities. And the bill also talks about opioid settlement fund and to be considered for that purpose. Section 4 is about harm reduction advisory committee, and there are many members of the existing harm reduction advisory committee. There is a whole plan of what that committee is going to be made of. It is a part that may actually improve further. So I just wanted to give you a heads up that this part of the language may potentially change. Section 5 is about opioid antagonist bulk program purchase fund. We know that Narcan helps, and we need to make sure that it's easily available. We want the municipalities to have it, and this is about making sure that there is enough funding and support for having bulk purchase of Narcan, so that the wholesale prices is what the municipalities and other partners in protecting our citizens is going to be available. Section 6 is having a prescription if they are provided to an individual who is at a high risk. Important to note, it's only for high risk individuals that an opioid antagonist would automatically be provided as well. If somebody is going to be provided high dose of opioids for their pain, we want to make sure that they have antagonists available to them. If somebody has substance use disorder to begin with, you want to actually provide it to them, or if an individual uses benzos along with the opioids, they should be able to have an opioid antagonist available. And this is again something that we have seen as a high risk group in individuals. So that's some of the parts on the section 6. We have 24 parts, so just so that take a deep breath. Section 7 is by January 1st, 2024, OEMS and DMIS and DCP will work for opioid antagonist kit and then have that leave behind. So if somebody is found to have overdose and we cannot bring them in and they're not worse enough to be in the hospital or emergency department, they would be able to leave the opioid antagonist or the Narcan or naloxone over with the person so that they would have that available to them. We've lost some people because they would have the reversal, but then they would not be willing to go back and be admitted. And later the second time around, they would not make it. Section 8 is a way of making sure that Section 7 is filled, so the pharmacies would be able to help out, have a standing order to provide EMS services to have more opioid antagonists if they have been used up. Then we're moving on to Section 9. Section 9, now we are changing gears a little bit. We are looking at another component of the healthcare workforce in the picture, where the Commissioner of Education will be working and creating a healthcare career advisory council. The Healthcare Career Advisory Council, again, healthcare workforce is a major challenge that we are experiencing as a state post-pandemic. This is, as I would say, the first ripple of the pandemic where we are having major difficulties recruiting individuals, but also the pipeline of healthcare workforce. So this is going to create a career advisory academy with people of various backgrounds from the hospitals, from physicians, nurse practitioners, physician assistants, social workers, psychologists, pharmacists, you name it. And then they will be able to work with the middle school and high schools across the state to be able to identify ways of providing first some guidance, but also in the process open up opportunities for internships and shadowing opportunities for individuals, for our youth and middle and high school kids to start to fall in love in medical fields. Section 10 is expansion of the nursing workforce in the state. It's no secret, there's a shortage of nurses across the state, but within the state, we have a number of hospitals and agencies that require nurses as well. We are trying to look at how we can improve that opportunity, and there's the Section 8 deals with that, to have efforts around and comprehensive efforts to address that. Section 11 is trying to, because in order to have clinical experience, we need clinical experienced teachers to be able to help out. The adjunct faculty is part of Section 11, which is to have an individual with 10 years of experience who would be able to serve as adjunct faculty if they choose to. But the challenges in nursing field is that there's such a demand right now that if a nurse is going to provide clinical care, they will make far more money than they would in teaching, which is unfortunate reality in our state and across the country for that matter. So we are trying to make sure that the Office of Higher Education would have incentive grants to be able to make sure that the person does not take a financial loss when they are educating the next generation. Section 13 is nurses' aides having competency test in English and Spanish language. We want to try to expand that opportunity. And Section 14 is personal care attendants and their career pathway. We need the personal care attendants as well. And we also need them to be specially trained in different paths in the part because as a population ages, there's an opportunity for cognitive impairment and behavioral health pathway for personal care attendants. There's a complex physical needs for individuals who have multiple physical needs. And then there's a transition to home and community living. So that's another area where we feel it's best if people can live at home rather than at facilities. So we want to make sure that the next generation of workforce would look at that. The next section 15 is about board eligibility and board certification for credentialing with the hospitals. This language had inaccuracies in the past. After listening to some of the testimonies, we have changed the language, but it looks like the language may have to change even further. So this would be work in progress, because that language is not where it should be right now. So we'll work on that a little bit. The section 16 is restrictive covenant for physicians and APRNs to be removed. These are the two clinical groups who are working independently, and that's why having them to not be impacted by restrictive covenant is important, because some of the contracts that are out there would actually have them move out of the state. And the next section is about malpractice reform task force, and looking at how we can improve that long term, because we're trying to keep our clinicians in our state and not having them leave. Section 19 is a physical therapy license compact. License compacts are very complex bills, so a lot of those pages are about those license compact. And then section 20 is to make sure that there's a background check done in advance, and that would allow us to make sure that we're not back here fixing the previous bill like we did for the physician compact. Section 21 is about podiatric services and some of the concerns that they have, and we are going to connect them with the DPH on looking at specific areas of concern and work with orthopedic surgeons on their aspect. Section 22 is about APR and reciprocity, and that will initiate October 1st, 2023 for individuals who have practiced 3 years in another state with the same level of training as there is in Connecticut. They would be able to come to our state. And section 23 is Office of Higher Education to have help grants for individuals who are working in the rural parts of our state. So rural part of our state are going through some challenges. We want to make sure that we provide protection and incentives to individuals to be able to provide care about that. And section 24 is to have a reminder that splash pads use recirculated water. So don't drink that water. And so we'll have that sign over for every individuals who actually forget that in case if they are using splash pads. So I think that covers the bill most likely. So thank you so much, Madam Co-Chair, and I'm sure. Thank you. The splash pad is to just change the environment a little bit, so we don't think about the other parts of the bill.
All right. Well, thank you, Senator Amor, for that thorough outline. I know we are going to have discussion and questions on the bill, and I will begin with Representative Claritas Tetria.
Thank you, Madam Chair. Thank you, Mr. Chair, for your detailed explanation of all section 24 sections of this. My first question is on the harm reduction centers. How did we just come to 3 harm reduction centers and maybe not just starting out as 1?
Senator Amor.
Thank you so much. I think the reason for the 3 was because of the sheer burden of the challenge that we are facing in our state. So 1 would have been too little and would not have been able to have a broader impact.
Okay. And you mentioned something about in the language in here with the federal funds being are we going to be able to use the federal funds for these harm reduction centers for the safe injection sites, or where will that money come from if it doesn't come from federal funding?
Thank you so much. Should I be saying through you or should I? Yeah. Okay. Through you, Madam Co-Chair. I think we won't call them drug use or the title that you used. We're just calling them harm reduction centers. So they will not be consumption sites as far as we are concerned. So we've changed the language because if they are consumption sites or observed consumption sites, the federal law will restrict us. And because the federal law will restrict us, we would not be able to use the opioid settlement fund, as our commissioner had and others had explained to us. So we feel that we are just going to look at it not as a observed consumption site, but a site for harm reduction.
Okay, so just to clarify, I'm a little confused. So are you saying you're changing the name so we can still do safe injections, or not doing safe injections at all?
Safe injections are not a part of this effort.
Okay, So if they're not part of this effort, I thought we already have harm reduction centers in the state of Connecticut.
There are very few, but we need more. And we need more support for them.
Okay. Okay, next section, do we know how much funding will be going into whatever we're expanding in these 3 harm reduction centers?
That is something that we have not looked at in as much depth. We have looked at what are the parts there. So we are not asking for appropriation at the present time. This would be decided by the opioid settlement fund.
Okay, and in section 15, you talked about that still needs a little extra work about the credentials for any board certification in a particular specialty. There was 5 years in there, and that was offering some confusion. Why was, if you can just expand or explain that in a different
Sure.
way?
Thank you. Thank you for that. Through you, Madam Co-Chair. It's all right. I have permission. Okay, we have permission to, when a person completes their residency or a fellowship, they become board eligible. And sometimes it takes a little while for the board eligible individual to complete their boards. So that should not restrict them from their credentialing process. So that was the intent for that. And many of the hospitals allow 5 years already, but it's not necessarily in every hospital. And the way the language is written, it can improve and become more clear on that part.
Thank you for the explanation. And then the section, I don't remember which section, the blood plasma centers. I know we have that in 2 different sections. DPH has in theirs. They're both, as is written right now, they mirror each other. Is that correct?
Pardon me, can you?
The blood collection, blood plasma centers, they're in 2 different, it's in 2 different bills. Correct? It's in SB 9 and it's in the DPH revisions bill.
So that is actually in a different bill. So it's not SB 9. That'll be in another
was
bill
different.
that we'll go through. It's in the Department of Public Health, various revisions bill and a separate.
And a separate bill. Okay, I
Yes.
apologize. So
No,
I'll ask
don't
that.
apologize. It's a lot to keep track of.
I'll ask that later. And then,
Can I clarify something
Yes,
quickly? In the current language on the JFS that we are seeing on line 32 to 35, there is mention of the consumption of substances that will be improved on. So we will address that because we want to make sure that the opioid settlement funds can be used for the sites. So, and we will make sure that the language is in compliance with the federal language.
so there will be consumption now?
No.
No,
The current language still has that information, but we'll be removing that.
Okay, thank
We
you.
will change the language, but did not remove one part of it, so we'll be able to address that.
Okay, thank you. And then section 23, the loan reimbursement grant program, do we have any idea of the cost of that?
Not yet.
Okay. All right, I think that's all the questions I have for now. Thank you, Madam Chair.
Thank you.
Thank you, Senator Elmore, and thank you, Representative Claridis Tetria. Senator Summers to be followed by Representative Zupkis, to be followed by Representative Cook.
Okay, thank you for the clarification on the harm reduction center. So previously, I was not interested in supporting that because it was federally illegal. And I've had a lot of conversations with our police chiefs that were not in agreement of allowing for a safe injection site for a variety of reasons that I won't go into, because you're saying you're gonna take this language out. But again, it's a work in process. So right now, currently, we will be voting on it, and it does actually say that you would be able to inject safely consume controlled substances under the observation of a licensed healthcare provider that's there. So these harm reduction centers, could you please explain for the public what that actually is going to be? It's going to be a place where you can go in if you're suffering from opiate use disorder or other disorders, or just opiate use disorder. You would go in, there would be a clinical person on staff. We're going to be using federal dollars from the opiate settlement for these centers scattered across Connecticut. A municipality, I'm assuming, would have the ability through zoning, whether they wanted one of these harm reduction centers or not. And a person could come in and they would get access to counseling, to referral of services, to a hot shower. Is that correct? And sort of the wraparound services that you would need to try to help somebody get into treatment for opiate addiction? Would it also connect people if there is a navigator pilot in that particular area where they could get in touch with the navigator system that we may have? Okay, are those areas going to be in the same locations that we have navigators? Or are you going to specifically try to choose different locations so that you're not really duplicating services? Can you?
Thank you. Actually, your explanation for the services was right on. So that's good. With respect to the location, the bill is silent on the location because that would be decided by the community. So we do not have anything in the written where those locations would be.
So would a community then apply to have a harm reduction through the, okay, I just want to be clear so everyone understands, because the language is different, so I wanted to make sure everyone's on the same page. And then we would be using or requesting to be using opiate settlement funds because those settlement funds are coming through a board that will decide where those opiate settlement funds are going to be used, correct? Okay. And then, I just wanted to be clear on that. The section in here that requires a clinician, to prescribe a antagonist for opiates. I'm not sure we need that because most clinicians are probably doing that at this point, and opiate antagonists are available everywhere. You can get them anywhere. So I'm a little concerned about putting that into statute that a prescriber must do this because the language is shall, as we don't know what's going to happen in the future, whether we're going to need that, et cetera. Maybe there's a different alternative that comes along. So I'm a little hesitant on actually requiring that in statute. But I wanted to make sure that we were clear on these harm reduction centers because there's been a lot of information on those. So thank you for spelling it out. Again, if people vote no on this today, it could be because the language is not reflective of what the description has been here today. But I thank you for your promise to make sure that language is changed and that everyone is clear what a harm reduction center is now. That's really important for everyone. Thank you.
Thank you.
Thank you, Senator Summers and Senator Amar. Representative Zupkus to be followed by Representative Cook, to be followed by Representative Steinberg, to be followed by Senator Gordon.
Thank you, Madam Chair. I don't mean to beat a dead horse, but I'm not clear on the harm reduction centers because now we have them already. We want to add 3 as a pilot program, but they're doing what the harm reduction centers that we have are doing already. Is that correct, Mr. Chair?
Thank you. So the harm reduction centers are not as many, and then they are just local efforts by the community and some support from DEMIS that has allowed them to be able to get Narcan and also to get the fentanyl strips. Their capacity is very limited, very limited. So if we were to say that in their potential needs perspective and their current status, they are probably providing 5% of what the needs are. So that would allow individuals who are working or the organization that are working in that direction to be able to expand those services. And that's what, and also provide the services, including connection with the navigators, in connection with social workers, connection with psychologists and clinicians and in medical care as well.
So it's to expand the services.
Most likely.
Okay. And will all of the harm reduction centers, I don't know how many we have now, I'm just saying 5. If we have 5 and we're gaining 3 more, will they all be, I don't want to say analyzed, but looked at and through DPH to see what can make a difference, what's being done, what needs to change for the better?
Yes, DEMIS will be coordinating this effort. So we'll
Through
make sure.
all of them.
Yes.
Great. Thank you.
Thank you.
Thank you. And then my last question is in the section that I know it was removed about the criminal penalties for people who attempt to injure or interfere. So what, like in section 1, it says no person or entity may prohibit all of these things. C has these things that can't happen. So what's the penalty now if something happens?
That's a part that's no longer part of the bill anymore.
So there's no people, so it really does nothing, right?
Nothing.
Okay.
The status
you.
quo.
Thank you, Mr.
Thank
Chair.
you. Thank you.
Thank you, Representative Zupkus and Senator Anwar. Representative Cook to be followed by Representative Steinberg.
Thank you, Madam Chairman. And I'm not sure which of you would like to take this question, but I do have a question regarding section 22. When we talking about nurse practitioners and the like. And my question is more along the lines of clarification. And so does this change that we have addressed in the new language recognize, is it in recognition also of the independent practices for collaboration? As opposed to simply where we are. So if, in other words, if an APRN has satisfied in another state and they come here, are they able to do the collaboration, or are we going to expect them to do more?
Thank you so much for that question. So an APRN who has done 3 years of their training and training to the same level as it is in the state of Connecticut, they would just walk in and start right away.
And then, but they would still be required to work with underneath a Connecticut physician, correct?
No, if it's the same level of training that we have in the state of Connecticut, in another state, they would just walk in and start. Of course, they may want to work with somebody, but they don't have to.
Okay, thank you. I want to make that clear. I think it's important for the folks that have been really working with us. I'd like to be able to collaborate with them and make sure that we are on the same page and that our understandings are correct. I have no issue supporting this as we move forward, but if we find that there's a glitch in what the language might read or interpret, I'd hope that we would be willing to work on that. So thank you.
Yes, thank you.
Thank you, Representative Cook and Senator Anwar. Representative Steinberg to be followed by Senator Gordon.
Thank you, Madam Chair. Just a comment. I don't suppose I'll ever get totally comfortable with the big Senate bill aircraft carriers, though I have been complicit both on the Energy Committee and on this committee in the past. I find having so many disparate elements very difficult for us, but also the public to follow. And I wonder sometimes whether even we members of the committee are aware of everything that's in these bills, particularly if they're works in progress and are changing. Having said that, I'm generally in support. I will say that I'm very encouraged by the services that these new prevention centers will create. However, I'm also disappointed. I think that one of the key elements of these centers is actually to allow for safe injection. And that's the model that I think we really want to test out. I certainly don't want to sacrifice access to federal funds, but I would hope that if other states continue to prove the effectiveness of that option, that we consider other funding sources so as not to run afoul of the federal guidelines, and to consider that in the state of Connecticut as well. We want to maximize the benefit for people who are addicted. We need to avail ourselves of all the proven services that should be available to them, and we're falling short. Thank you, Mr. Chair.
Thank you. Thank you very much. Thank you very much for those comments, Representative Steinberg. And I will just add before I go to Senator Gordon, I appreciate those comments. I will say that going into the hearing last week, before we heard from all of the folks testifying, I had a lot of uncertainty, but listening to that testimony was extremely powerful and transformative in terms of my perception of how we need to go forward. But with that, I will go to Senator Gordon, followed by Representative Mara, followed by Representative Kennedy.
Thank you, Madam Chair. I'll limit my questions. I have so many, we could be here all night. Although I'm prepared to be here all night, I won't subject that to my colleagues on the committee. So I just have a few questions on a couple of sections. And I know this has already been answered. I just want to make certain I'm clear on it, because the devil is in the details and we haven't yet seen any wording changes beyond what we received yesterday. So as not to beat a dead horse, but I'll go ahead and do it anyway. Is my understanding correct in what's been said through you, Madam Chair, that the wording is intended to be changed with regards to harm reduction centers so as not to allow consumption of illegal drugs or illegally used controlled substances on the site, given the fact that the federal law doesn't allow it and the Commissioner of Demas cited that as well? Is that what's been said through you, Madam Chair?
Yes, the bill has still, at this time, lines 32 to 35 had that, we'll just remove that part. So the bill is not talking about drug use or anything, it's just providing the services to the individuals for harm reduction opportunities for them.
And thank you. I appreciate that very much, clarifying that. As a senator and as a doctor, I do support efforts that are responsible and legal to see what we can do to help people. And we do have to be mindful that the state really should not be trying to supersede federal law. And the Commissioner of Demas pointed that out very much. So if the intent is to not have that part, which is contrary to federal law, whether or not it tags into any federal funding or not, then that's something I certainly look forward to seeing, what can be done with regards to expanding services to try to help people, as opposed to, and for lack of a better term, enabling ongoing drug use, because we certainly want to see what we can do to have people not be using in the first place, and safely get off drugs through established and evidence-based treatment programs. So I appreciate that clarification. Thank you. And then one other question, if I may, Madam Chair, is not so much a question, but in Section 6, I agree with what Senator Summers said about why would we be mandating medical practice. I can tell you, as a cancer doctor for 30 years, I prescribe a lot of narcotics appropriately. And I do prescribe when I feel it's important, Narcan. I prescribe other drugs that actually can have other side effects. And sometimes I have to be aware of the reversal agents of those drugs. Doctors are well aware of CDC guidance, which came out in 2022. We're well aware of FDA guidance that came out several years ago about opioids. I believe to mandate medical practice really interferes with the patient physician or patient healthcare professional relationship. We should not be doing that. I can tell you, as a patient myself, I don't want government telling my doctor or nurse practitioner who I see what to do and what not to do. That should be a decision on a case-by-case basis, done longitudinally, and not have the government involved with that. So my question through you, Madam Chair, is there really a need to be mandating that versus to allow what we know is already being done out there in medical practice for those who are prescribing? Especially those who are prescribing sizable doses of these medicines appropriately in patient care situations in and out of hospital. Through you, Madam Chair.
Thank you. Thank you for that question and that comment. I agree with you that this bill is only addressing a very specific group. And that group is individuals who are known with substance use disorder. So, and many of the individuals have chronic pain. And if they are known to have substance use disorder, that is the group that we should provide an antagonist. And that's already happening, like you've said. But the other group is if the dose is very high. And so that's where morphine is like 90 milligrams. And another part is that if the individual is using benzodiazepines along with this. So these are the high-risk groups where by taking a little extra dose may actually cause them to have a respiratory compromise condition. And that's the reason to have that available. Not everybody is not doing it. So requiring it would just add a protection in just this group. For all the other usages, it is not requiring that. So in other words, overwhelming majority of your patients may not necessarily need the opioid antagonist prescription, but this small group that is a very high-risk group is where it would.
Thank you, Madam Chair. And I just wanted to clarify with a follow-up question. This list lists 3 categories. I can tell you there's other categories that one can worry about. For example, if someone has bad COPD, I do worry when I have to prescribe even an anti-anxiety medicine, because sometimes that can depress their respiratory function. So I just want to state that we need to be very careful when we're having government, state, federal government, try to intercalate itself into patient care, because a doctor or another health professional knows the patient, follows the patient, government does not. And we need to be very careful. And my follow-up question on that, which I believe is my penultimate question for right now, is if it says shall, through you, Madam Chair, is there an enforcement mechanism? If we're going to say it needs to be done, Is it going to be enforced? Because why have a rule if you're not going to enforce it? I don't think we need the rule, but through you, Madam Chair, is there going to be an enforcement and what would be a penalty?
The bill does not mention anything about that.
All right, well, thank you. And then my last question is, and this may be technical, but the very last section talks about splash pads and mandating signs. If the state were to think this is an important public policy, and I'm not saying I'm against it, is this something that is an unfunded mandate on these businesses, or is this something the state's going to fund? Through you, Madam Chair.
The bill asks that a sign be placed in, and so that the individuals or the children who are adults who are with them would know that it's recirculated water. So there've been outbreaks of illnesses in some situations. So that's the purpose that we want to make sure that everybody's aware of the fact that it's recirculated water, and it's just a sign. So there's no funding from the state for putting that sign.
No, well, thank you, Madam Chair. That's all my questions for right now. Thank you.
Thank you, Senator Gordon. And yes, well, Mr. and Madam,
I respond to everything.
I know we're very much a team today, so it's back and forth, and I appreciate you all working with us on that. Next is Representative Mara, to be followed by Rep Kennedy, followed by Rep DiCaprio, and followed by Rep McCarty.
Thank you, Madam Chair. And I actually didn't hear you mention this during the breakdown of the bill, but I believe still in the bill and section 13, it requires DPH to offer nurses aides competency tests in both English and Spanish. Is that still in the bill?
Yes.
Okay, thank you. And then just a comment on that. I love that we are opening it up, and my concern here is that if we have someone that is taking the test in Spanish and they're coming into a facility that may not have material that is in Spanish, are we setting them up for failure in that facility? Do we need to support them within the hospital that they're working at too? Or are we concerned about this? This is like, I know we've had this like on driver's tests, which I think is, phenomenal. Yes, let's do that. But when you drive, you're not reading materials in, medical terms. So there's not that risk. So that's my concern. I just do not want to set people up for failure on the other side after they've completed their competency tests.
Thank you for that important comment. Thank you.
And then if I can just add a second comment as well, and this is on the harm reduction units, and I am disappointed to see section 32 through 35 removed. However, I really appreciate seeing the harm reduction unit in the city, and was amazed by some of the links that they were going through. And I will still support this because I truly believe that the wraparound care that's offered to this community is very important when someone comes in. And I assume that when they come in, they will still be able to do needle exchange. They will still be able to have consultation. They will have access to social workers. They will have access to medical care. And to me, that was at least 90% of what was so important to this community. So I will continue to support this. And then maybe further down the line, we can look at consumption as well.
Thank you, Representative Mara. Thank you. And thank you for your time to visit the site. And it was, I agree with you. Thank you.
Thank you, Representative Mara and Mr. Chair. And I think your comments and your exchange focus on the impact of hearing directly from some of the folks who are suffering. And I appreciate that. Representative Kennedy, to be followed by Representative DiCaprio.
Thank you, Madam Chair. I just have a quick question for clarification on lines 1451 through 1467 regarding the APRNs. Is that specific to people that are currently working as APRNs and coming into Connecticut, that they would be required to apply for a license? And in fact, there would be a $250 fee. Am I understanding that correctly? For you, Madam Chair?
Thank you. Could you name
It's
the,
on lines 1451 through 1467.
yes,
That's just for someone coming from.
they will
okay.
have to
I
pay. for
appreciate
the
that.
license.
And then just one brief comment, and I know we've been at this a lot, but there's so much in this one bill. Just following up to Senator Gordon's comments on the splash pads. We actually have one in our town. Personally, I'm not really fond of splash pads myself personally, but do we know what the cost will be to the municipalities? I mean, we're just talking signage and that's it? Through you, Mr. Chair.
So the bill does not mention the type of sign. But I think it's a basic informational sign, so it should not be that expensive is how we see this.
I appreciate that. Thank you,
Thank
Mr.
you.
Chairman. Thank you, Madam Chair.
Thank you.
Thank you very much, Representative Kennedy, Representative DiCaprio, followed by Representative McCarty.
Thank you, Madam Chair. Just maybe an easy question. Just how many harm centers do we have in Connecticut right now? Do we know? And I think I understand there might be one in Hartford, but could someone share something about that? Thank you.
Sure. I know of the one in Hartford, but I know that there may be some smaller informal ones. And it's just community generated efforts, but I've seen the formal one in Hartford, which includes a physical space, but it needs a lot of more financial support, but also there are mobile parts to it as well. There's a vans that go out and help out in some of the communities to increase their impact. That's the only one that I know. The others have been speaking of it. There are groups that are coming together to talk about the needs because too many people have died in many of our communities, all of our communities for that matter. So there are individuals who have been talking about it. So that's the only one that I'm aware of, sir.
All right. Thank you, Mr. Chair. That was my understanding too. There was just Hartford had one. Thank you very much.
Thank you, Representative and Senator Elmore as well. Representative McCarty.
Thank you very much, Madam Chair. I just have a comment and then perhaps a quick question. First of all, I'd like to add my voice to the support of creating new harm reduction centers in the state. What we have done so far, we have over 1,500 opioid fatalities every year. And so we need to we need to do more. And I know the harm reduction centers meets the person where they are and tries to connect them with all of the possible services to help them lead a better quality life. So anything we can do. I'd also like to align my comments with those of Representative Steinberg and Representative Mara. I'm quite disappointed, but I understand the federal issue. We receive a good deal of our funding through the block grants, so we can't be in disharmony with what the federal regulations are. But I am hopeful going forward that we can find a way. The data show that they're saving hundreds of lives. And to me, that's what I'm looking at right now. How can we save lives till we find a better way to approach these disorders, which are really truly a disease? And we have to keep that in mind. These are diseases we're talking about. We need to remove the stigma and help these individuals go on to lead a quality life. So I just wanted to take that opportunity to express my concerns. I do would like to also just ask, with the use of Narcan and asking for the prescription with Narcan, will there be education involved there also, that in some of the cases, especially if someone has not been using the opiates or the drug, that the education will say that one use of Narcan may not be sufficient? I'd just like to see somewhere that we highlight that's an important piece. Also, I'm on the education committee, as you know, and we've been doing a lot of work in education also and looking at career pathways. And we know we have a tremendous nursing shortage, but I would just like the committee to keep in mind as we do this, that we have to be mindful that we're putting a lot of mandates and requirements on the various departments. So we'll have to look at funding as well. And if there's going to require, this one is okay. It's putting a council together that will continue to look at it. And then finally, and please excuse me, I know we have a long meeting ahead, but I was concerned going back to section 1 in the language of when we're looking at assisted reproductive technology and accessing it, the language in that 4th line says unreasonably limit. Is that a legal term that has definition to it? I'm just trying to see what in fact we mean by an unreasonable limit to the access to that technology.
Thank you so much for your comments and thank you for the work that you do. In education committee as well. I just on the last question, it's basically broadening the language. It's pretty broad and on purpose because people can use that argument if somebody's creating hurdles in the process of somebody getting in vitro fertilization. So that's why it's intentionally placed in a very broad sense. So that's the intent of it. It's not necessarily, it is a legal language. Every document has a legal component to it, but it is meant to be very broad. And that's why it's put in that manner.
Thank you for that explanation. I thought the word prohibit in front of it would have done, but this to me gives it a little lighter appearance, but thank you.
Thank you.
Thank you, Representative and Senator Otmore. Representative Foster.
I'll be very fast, but I'm just still smiling to myself thinking about section 24. On behalf of parents of toddlers everywhere, we know they shouldn't be drinking recycled water at a splash pad, and we know they shouldn't be eating playground sand. We're just fast and very wily at that age and challenging to keep up with. So I hope that this improves health and wellness of children across the state. But I think most parents know that their kids shouldn't be drinking this splash pad water or eating playground sand, but that does not change the fact that the children really want to put everything in their mouth when they're little. So thank you.
Thank you for that.
Yes, thank you for that fun reminder of playground life. I'm just checking online. Seeing and hearing no other discussion. Oh, I'm sorry, Senator Gordon for the second time.
And I'll try to be brief. Thank you. I just want to make a couple quick comments. The sections that deal with the no compete clauses for APRNs and nurses, I applaud having that. I think it's good to be looking at that, especially as we're dealing with the ongoing consolidation of healthcare in this state. People can get boxed out literally geographically, and we also have to be mindful as health systems continue to consolidate. That could also mean being boxed out across the borders of Rhode Island, Massachusetts, New York. When you're talking about how far away you have to be in order to practice or not practice. So I think that's good to do and to look into, and also to the section 18 that deals with looking at medical malpractice issues. That's a big issue. It needs a lot of reform and help. So I applaud looking into that. I just have a quick follow-up question regarding section 6. I know I had asked earlier about, I guess there's any enforcement, but there's no enforcement. But if a doctor or say a nurse practitioner doesn't know that someone has a history of substance disorder, or asks and a patient may say no, or doesn't even know that someone is on a benzodiazepine, for example, for anxiety, and it's not even on the patient's med list, and the patient doesn't even say it's on his or her med list, are we going to be holding them, these people, harmless because they just don't have that information, yet they're prescribing and not then prescribing a reversal agent? I think we need to make certain that there's reasonable flexibility, but also what happens in a situation where someone prescribes appropriately morphine for, say, cancer pain, and it happens to be more than 90 milligrams. I have patients who I do prescribe much more than 90 milligrams a day of morphine, and they don't prescribe a reversal agent. And say a pharmacy or someone else, quote unquote, reports to DPH. Is DPH going to have to be mandated to evaluate that? Heaven forbid it goes to the medical examining board for a review. Through you, just had those questions as far as the practical real world way this would be used or handled.
Thank you for your comments. I'm taking notes. I think you make important points. The language needs to be tightened a little bit and we need to clarify some of these components. So I appreciate your insight.
Thank you very much. Happy to work with you on that, but thank you.
Thank you.
Thank you, Senator Gordon. Senator Marks.
Thank you, Chair, through you. Just in response to that from Senator Gordon. So nowadays we have Epic, so most people, most clinicians do know exactly what the patient is taking because it pops up right into your chart. And maybe it doesn't in Massachusetts, but in Connecticut it does. And I just know that when I go into the homes of patients who have been sent home with a large amount of narcotics, believe it or not, fentanyl patches, I have plenty of patients on fentanyl patches that have other people in the home and children in the home. You want that Narcan there. So I don't think anybody's going to get arrested and put in doctor jail because they didn't prescribe the Narcan. But I think that by bringing this up, it will, and making this legislation, it's going to save lives and it's going to make people want to do it. There's still a stigma against Narcan that people think, oh, only drug addicts need Narcan. And it's not true. Many people overdose on Narcan. People overdose on Tylenol, take too much Tylenol and end up in the emergency department. So anything that can prevent one person from overdosing on an opioid, I think is a great idea. And just then in response to the, I wasn't going to say anything, but the harm reduction sites. I too, just like many of my colleagues, are disappointed that they're not going to have safe injection sites. I thought the testimony that we had at public hearing was some of the most amazing testimony I've ever heard. I actually want to make a little clip of it to share it with the nurses that I work with. I think stigma is the number one factor that we always have to think about when it comes to opioids. And when they said that it takes most people 12 to 14 years before they can resolve their substance use disorder, I've never heard that statistic, and I deal with this all day, every day when I work. And I just found it fascinating. And like Representative McCarty said, that any life we can save is just so important. So I hope moving forward, we can do more great work. And I thank you all for everything.
Thank you, Senator Marks. I believe that's the last of our comments, and I will just close by again thanking everyone for this conversation. I had a chance this morning to be with a group of high schoolers, and the last question of the day, even though it was a Women's History Month event, was actually about drugs. And I had to share with them the experience that we all had here at our committee, listening to the testimony. And our goal is to make sure that those kids never find themselves in the position that they need to use a harm reduction center. But I think what I'm hearing here today is that we want to be sure that we're offering these wraparound services. We want to be able to provide the support that's needed for people to meet them where they are, to be able to save lives, and that perhaps as we go forward, we can build on this work to allow the space for that safe injection. But where we are today, though the language as it's reflected in this S language is still there as this moves forward, that will be coming out, but we've got a lot of work to do and this is a step forward. So seeing and hearing no other comments, Madam Administrator, would you kindly call the roll?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy Vahey,
Representative McCarthy Vahey votes yes.
Senator Kushner,
Senator Kushner votes yes.
Senator Marks,
Senator Marks votes yes.
Representative Parker, Senator Summers,
Senator Summers votes no.
Representative Clarice Detrier,
Representative Clarice Detrier votes no.
Representative Belton,
Representative Belton votes yes.
Representative Burgess Javalo,
Burger Javala votes yes.
Senator Cabrera, Representative Carpino, Representative Cook, Representative Dauphiné,
Rep. Dauphiné votes no.
Representative DiCaprio,
Representative DiCaprio votes no.
Representative D'Amico,
D'Amico votes yes.
Representative Denning,
Representative Denning votes yes.
Representative Elliott, Representative Foster,
Representative Foster votes yes.
Representative Django,
Representative Django votes yes.
Representative Gilchrist, Senator Gordon,
Senator Gordon votes no.
Representative Cabris DeGraw, Representative Kidd,
Representative Kitt votes yes.
Representative Kennedy,
Kennedy votes no.
Representative Linehan,
Linehan votes yes.
Representative Morrow,
Representative Mara votes yes.
Representative McCarthy,
Representative McCarty votes yes.
Representative Palm,
Palm votes yes.
Representative Perello,
Perillo votes no.
Representative Rader,
Representative Rader votes yes.
Senator Rahman, Representative Reddington Hughes,
Representative Reddington Hughes votes no.
Representative Ryan,
Representative Ryan votes yes.
Senator Slack, Representative Steinberg,
Representative Steinberg votes yes.
Representative Terciat, Representative Welander,
Representative Welander votes yes.
Representative Zupkis,
Representative Zupkus votes no.
Representative Parker, Senator Cabrera, Representative Carpino, Representative Elliott, Representative Gilchrist, Representative Cabris DeGraw. Thank you, Madam Chair.
Thank you, Madam Administrator. Next item on our agenda is Senate Bill 1067. This is an act concerning adequate and safe healthcare staffing. This is a JF to the floor. May I have a motion?
So moved.
Moved by Senator Amor,
Senator Marks seconds.
seconded by Senator Marks. And I'm going to turn this over to Senator Amor.
Thank you so much, Madam Co-Chair. This is an important bill and it's an act concerning adequate and safe healthcare staffing. We had pretty extensive public hearing on this as well. This bill makes several changes affecting the nursing staff and overtime in the hospitals. It modifies some of the requirements for the hospital nursing staff plans. The deadline to initiate this is January 1st, 2028, which is quite a few years from now, 5 years from now. And to require specific ratios of patients to registered nurses, providing direct care per patient per unit, and the patients to assistive personnel as well. So this actually is going to be implemented in January of 2028, requires the hospital to post their plans on each patient care unit in a location that's visible, which is accessible to staff, patients, and the public. So that's important to have that information available as well. Requires hospitals to retain staffing records for 3 years to make sure that they have been abiding by the law when it's enacted. And records would be available upon request to DPH, staff, and the patients. And Also, it's about hospital staffing committees and how those committees could be able to become more functional and real is another part of that bill. And it also allows the RNs to object if they are asked to work in an environment or require to go beyond their training or education or experience. And that would be the time they would have the right to be able to say for that not to be able to do that if they feel uncomfortable with that component. Then and if they were to make that decision, no adverse actions can be taken against the nurses at that time. And it's also about the overtime policies for the nursing staff. Basically the mandatory overtime that we have seen in many situations, it's prohibiting the hospitals for requiring the nurses to work overtime and or take adverse actions against a nurse who's refusing to do so, with the limited exceptions. If there is a public health emergency, there's an ongoing surgical procedure, and the nurse is in the very critical situation with the patient. And under those circumstances, he or she will not be able to say no, but otherwise they would be able to say no if a mandatory overtime is requested by the hospital. And it also requires the hospitals under these limitations to make good faith effort to cover overtime hours with voluntary overtime before requiring nurses to work there. It's an important bill. It impacts a lot of our nursing staff. It also impacts nurses who have taken early retirement in some situations because of the workload and the challenges that they're experiencing. So, Madam Chair, it's a good bill. It ought to pass.
Thank you so much, Senator Anwar. Discussion, Representative Claritas Tetria, Senator Summers, and then Rep. Steinberg.
Thank you, Madam Chair. Senator Anwar, I had asked before, if this bill passes and someone's coming into the ED having a heart attack and they've met their ratios, so they can't accept them, they're supposed to now go to I assume the next closest hospital, but what if their ratios are closed as well, or they've met their ratios? What happens to the patient?
Sure, but by federal law, the ED will be taking care, providing them care.
So there'll be no repercussions if they take that extra person and something happens and someone tries to, any staff tries to report this to DPH or anybody, if they go over their ratio.
So in the emergency situation, the emergency department cannot refuse treatment to anybody for any reason.
And then, so what happens with enforcement? How would this be enforced?
DPH will be informed, and then there's whistleblower protection if somebody is chronically not addressing these needs.
And then what would, maybe in this bill, I don't recall seeing it, what would the penalties be?
The DPH will, I'll have to look at the penalties. I do not see that in the specifics, but the DPH will be looking at that, and that would be some compliance related issues, and then they would be cited for non-compliance of the law.
Thank you, Madam Chair. Mr. Chair for the answer, Madam Chair for the.
Thank you. Yep, we're keeping you all on your toes today. Senator Summers, to be followed by Rep. Steinberg.
Yes, while I applaud the idea of this bill, I will say, I think this bill needs a lot more work and it's not finished. I have had numerous conversations with the Connecticut Nurses Association, who would like to see different language that is in this bill. And I will be a no today to see if we can incorporate that language moving forward. They're as an organization, what they would like to see are different changes that are in here, rather than moving to the model that's here that follows California, which really, I'm not sure they've increased their nurses. If you look at the report, the outcomes of patients may have been slightly improved, but they haven't really improved nurses in the hospital and their satisfaction. But they would like to see things such as the annual report that is now already provided to DPH to do it on a biannual basis to actually look at the data rather than just basically delivering the data to DPH and DPH doing nothing with the data, so to speak. They would look to in sections on the staffing committee, assist in the preparation of the nursing staffing plan. We do that now. We already have nursing committees, but looking at the committee makeup and the membership to have at least 50% of those members be nurses who provide direct patient care and also ensure in participation by the nurses by providing coverage for them when they're working on the unit so they can attend these committee meetings. And, you know, full coverage so the bedside nurse can attend the meeting, the representative from each patient care line, add transparency to remove the ability to use another committee, make a dedicated staffing committee, annual notification of selection of the members of that committee. And there's a list that goes on and on and on. So I would like the opportunity to bring this language forward because I think although this bill is well intended, the practicality of it and the implementation poses great issues for the hospitals themselves and for possibly the patients in certain circumstances. You just heard, we're getting two conflicting stories. During testimony, we heard from the hospital association, if somebody comes in, it may not be an emergency, but if they came into the hospital and there wasn't the appropriate or the staffing ratios that are needed per this bill, the hospital could have to say, I'm sorry, we can't take you in. That patient has to be transferred someplace else because they would not be able to maintain this or face fines on the other end. So those are things I think that need more detail and more work. And there's some overtime issues in here that I think really, if I look at this bill and talking to the nurses that support this bill, maybe not on this particular committee, but they're having trouble with their unions getting what they want. So instead of being able to deal with their union leadership, who we have been told is not listening to them, and then they're coming here to try to legislate this through statute. So that's what I've been told directly. I can't speak for the union leadership, and I'm just letting people know what has come to not just me, but many of us on the committee. So I would like to see this bill be changed so that it's in line with what the Connecticut Nursing Association would like. So that's why I will be a no today. Thank you.
Thank you, Senator Mock.
Thank you, Madam Chair, Co-Chair. I just wanted to mention that we've been in conversations with the various groups of nurses and also the hospital association. There will be ongoing conversations, but we do feel that we should pass this bill today. There are obvious issues with the bill with respect to the impact on the hospitals, but clearly the existing system isn't working. The broader challenge that we have had is that before the pandemic, the ratios were a challenge to begin with because of the financial issues with the hospital or their policy decisions. But during the pandemic, the nurses were working and taking care of far more patients than they would without emergency situations. And what it appears some of the healthcare systems may have said, well, you can manage a lot of patients because you did that during the emergency and the pandemic. So let's do that every single day. The issue is that we are not in the same level of the emergency or the pandemic, and the nurses should not have to work at the same level with similar ratios as if it was the pandemic. So we need to go back to the drawing board and have this conversation again and say, let's fix this because it is not sustainable for a nurse physically, emotionally, morally to be able to provide less than perfect care that they have gone into healthcare for. And that's the reason we need to have this bill. But having said that, we are going to have conversations with both sides of the issue and then come up with a plan which will make more sense, and that's where we will be working on. So I would urge people to be able to vote for this going forward. Thank you, Madam Co-Chair.
Thank you very much. Rep. Steinberg to be followed by Representative Foster to be followed by Senator Gordon.
Thank you, Madam Chair. I find this bill difficult. I don't think any of us could hear the testimony we heard from nurse after nurse, dedicated professional nurses who have abandoned the bedside because they simply can't take the personal toll, nor can they justify the impact on patients. We have a problem here, and whereas it would be convenient to dismiss it as being a product of the pandemic, we had a problem prior to the pandemic. And I'm not sure this bill necessarily resolves the core issues as much as the symptoms. I've always resisted the idea of putting nursing ratios into statute because it severely restricts the flexibility of hospital administrators to put people where they need to be to protect people. It's very hard for us as legislators to anticipate all the scenarios that could affect that ratio decision. Having said that, I'm going to support this bill with the assumption that there will be ongoing conversations, but I will also submit that it's probably high time that we address the underlying issues. Hospitals are hurting, and the pandemic exacerbated tough circumstances. I feel somewhat responsible because as former chair, we have chosen not to address in the past the competitive issues that relate to a lot of the problems we have with our hospitals. We have two behemoths, and then we have a lot of other hospitals that were hurting for any number of reasons. And here we have those behemoths opening new facilities all over the state, putting great pressure on smaller hospitals, and also increasing the demand for nurses in all these little satellite facilities, which may not be in the best interest of patient care as much as having viable hospital systems that are able to go forward and provide care in the appropriate tertiary setting. It's easy for me to say, Madam and Mr. Chair, then perhaps next session we ought to be tackling the broader issues of consolidation of private equity firms, a lot of the pressures that have led to not only this particular symptom with the problem with nursing care, but broader issues across the state of Connecticut. I'm hopeful this bill will be resolved before it reaches the floor. If not, I will not support it, and I will actually argue against it. Thank you, Madam Chair.
Thank you, Representative Steinberg. Representative Foster, to be followed by Senator Gordon, to be followed by Senator Marks.
I want to thank this committee's leadership for raising this bill and their commitment to finding resolution and compromise between the parties who have testified for and against the legislation as it stands. I'm going to be supporting this bill out of committee today. Two primary drivers. One, I trust that our leadership is going to do what is best, given the testimony that we've heard for and against, to find a way that our hospital systems can be comfortable with where this bill ends up, but also that the nurses feel like they will get the much needed relief. This summer, I think, as many of us did, I worked really hard going door to door talking to folks, and made the unfortunate, horrible mistake on not one, but two occasions of ringing a doorbell at 10 a.m. of a nurse who had worked an overnight shift. And so had a really challenging conversation with a really tired nurse who had been through a really challenging situation. And I made a commitment to her, both women on both occasions, that I would make sure that this conversation was something that could be happening more than just a committee conversation, but something that would come to the whole legislature. And I will say that from hearing testimony from the hospital's perspective, from nurses' perspectives, I know that there's work to be done in this bill for us to get somewhere where we need to be. But for the nurses who are biding time in the meantime, the ones sticking it out when there is this exodus of bedside nursing to other work situations that people find offers more balance, we need to do something. And we can't wait for the language to be perfect here in committee if we can make the commitment for us to make it better by the time it gets to the floor. So I have tremendous trust in our leadership to do that work, and I thank you for your commitment to making sure we get there. But I also will say that, as you know, someone who knows someone in any moment who is in one of our hospitals and has a challenge, I think that that's something I never expected as a legislator, was to get emails from constituents who are patients in situations. People have this incredible gratitude to their nurses. They know how hard they're working to keep things going and moving, and they see the fatigue on the faces of their nurses. And so we have to find a way to make sure that we're not negatively impacting the hospital system so they're sustainable and viable. I want to avoid creating a bottleneck in the ED, because there are also nurses in the ED who would be negatively impacted if that becomes the waiting place for people to be referred to a floor that has adequate spacing, adequate ratios, I apologize. But I think that we need to find a way to make sure that we can protect that workforce and make sure that patients are adequately cared for and that our hospitals remain viable. And I don't think it's an either or proposition. I think it's both and we can get there. So thank you to the leadership for your commitment to getting there. And I look forward to my hopeful support of this bill when it ends up on the floor. Thank you.
Thank you, Representative Foster. Senator Gordon to be followed by Senator Marks and then Rep. Claire DeStitria.
Thank you, Madam Chair. And I just want to start out by saying I very much appreciate the wonderful work that nurses do. I've worked with nurses as part of patient care teams for many, many years, and I continue to do so in all sorts of settings and all sorts of times of day and night. So I think we all share the concern about just not providing the best and the safest care we can for patients here in Connecticut, but also what we can do to be helpful for nurses who are providing that care. So I don't think any of us have that in any doubt or any question. I do have concerns about the ratios as they are listed. I'm a proponent of trust but verify. So if I do vote no on this bill, it's because of the existing wording. I can't always rely upon wording that might be. I really need to see that wording. And I, for one, am more than happy and available to work with people, including the chairs, to see what we can do to make this bill better, but better in a way that is actually realistic and meaningful. We've heard a lot of testimony from nurses, written and in person or virtual. I paid attention to it and read through it, talking about the problem that we have now. It's not a new problem. It has been getting worse, and I do understand that. But if it is such a big problem right now, these ratios actually don't go into effect for quite some time. So even if this bill were to pass on the floors with these ratios in place, it will do nothing for a while, but yet the problem will continue. I did read through the information provided by the Connecticut Nursing Association, and I looked at it in detail, made a lot of notes, which I won't go through today in what my comments are. But I think there's a lot of very good points that are being raised, things that can actually be helpful now. And a few things I just want to highlight is the ratios in this bill are based upon what's in California. I can't say what's in California as it exists now is applicable or pertinent to what is needed here in Connecticut. California itself, in its law that was enacted, does have a process where it actually reviews every several years, how are those ratios working or not working, and then proposing changes. They understood when this went into effect that things aren't static and things do change. In fact, things can change very much in a hospital setting, not even considering the emergency room where things change every second, but things can change hour to hour, any time of day. And we have to take that into account. So having ratios in a bill now that's not going to do anything for a while, to me, doesn't do anything for the here and now. So I have concerns about setting ratios now that, number one, we don't really have the full collection and assessment of data specific to Connecticut. Maybe different ratios might be needed. I don't know. We really shouldn't just rely upon what's in California. And there's been some mixed studies. Some studies have said there's been some improvement in outcomes or improvement in lengths of stay. Some studies have not. I know there's a study cited by Dr. Aiken. That's a study from Australia. I can't say how pertinent that is to Connecticut. And I have read through that study in some detail. So I think it's important that if we're going to do things for here and now, we should actually make informed decisions. We should strengthen our process of trying to collect meaningful data, analyze it and assess it, work with our nursing colleagues to understand what that data means in the real world so we can better decide what really should be done. If ratios are to be done, for example, what type of ratios do we need? But we also need to make certain that we're including in the hospitals because there is flexibility that's needed. For example, a law that's in place in Massachusetts, which did set a ratio for ICU nurses, did put in a little bit of flexibility. I will note that ballot initiative in Massachusetts several years ago to expand the ratios did fail. I think it was around 70% no, and that was going to allow the Massachusetts Health Policy Commission to set some ratios. That didn't go forward, given certain issues about that. We should also very much see what we can do to strengthen the work that hospital staffing committees are doing, and very much include and loop in our nurses. And I do agree with what's been proposed by the Connecticut Nursing Association to make certain we beefing up our whistleblower protections, and also any type of accountability with DPH. So that's a long-winded way to getting to my question, if I may, is how are enacting ratios now going to, and waiting 5 years for them to go into effect, going to do anything for the here and now? That's my my question. Thank you.
Thank you so much for the question and your comments. It's no secret that we don't have enough nurses right now. We need to, and in a number of ways we are trying to address that. One of the bills that you'll hear of, and in the Senate Bill 9, they're looking at how can we increase the number of nurses in our state. So many of these hospitals have been in the process of trying to recruit nurses, and to put them under a ratio like today or next month or even a year from now would not be practical and would be dangerous. Because frankly, we feel that there are not enough nurses for those jobs, and the jobs have already been open. But we do feel that if we make those changes and put the investments that we are hoping to make as a state, we will have enough nurses to be able to fulfill the pipeline and the amount of staff that the hospitals require. And that is when we feel that they need to be ready. And for the hospitals to be able to say at this point that we are not ready, we say, well, we told you 5 years ago that you should be starting to work in that direction. So shouldn't be any surprise. So we're giving them the ramp up time and opportunity, but also creating the workforce that would be hired by that time. And if we make the changes this year, by 4 years, we will have far more nurses than we have right now. So that's how the 5-year number came.
No, thank you. I appreciate it. And I just want to argue my point again. I think what you said supports my point, which is instead of setting something now that we don't know what the landscape will be in 5 years, let's use this time to do things that can be done now to help nurses better understand about ratios in Connecticut. So that way, if something were to be implemented with ratios, it's been thought through more and we can make better informed decisions. So thank you.
Thank you, Senator Gordon and Senator Amor. Senator Marks, to be followed by Rep. Claridis Detria, to be followed by Rep. Supkis.
Thank you, Chair, through you. I obviously support this bill. I sat and listened to nurse after nurse after nurse. I think there were probably at least 50 nurses asking all of us to please put ratios at the bedside. These ratios are not, you have to have 2 patients to 1 nurse, although you should, and I believe it's Medicare regulation in an ICU, but they are the numbers that you start with. They're the numbers, these are the numbers that you start with your staffing. We all know that acuity comes into that. You can have a baby come in with croup, that you're going to have 1 nurse sitting there holding them, blowing oxygen in their face all night long, and that's going to mess up your ratios. We're all smart. We all know that no ambulance is going to turn around and not bring a patient to an emergency room because of ratios. That's just scare tactics by the hospital. No nurse ever said that. No nurse ever wants us to do that. The nurses asked you for this. The nurses are asking all of us for this. Every single one of us drives by every hospital for the last 3 years saying heroes work here. I can tell you, most nurses can't stand that sign. We are not heroes. We didn't go into this profession to be heroes. We went into this profession to be patient advocates. That is the number 1 job of a nurse, is to be a patient advocate. And if you are taking care of somebody and you're not able to give them the care that they deserve, if you're not able to hang the med at the right time, if you're not able to look up that medication because you're not really sure what the reaction is, if you're not able to get another nurse to come over to check your dose of insulin before you give that insulin. That is what being a nursing advocate is, and that is what these nurses are asking you to do. They go home and they cry. This has been going on since the 1990s. There isn't actually a shortage of nurses. There is a shortage of nurses who will work in the hospital. I work in home care. When I first started my career, pediatric oncology. I was going to save the world and just take care of all of these children that had cancer. I worked at Memorial Sloan Kettering, and after 1 year, I couldn't do it anymore. And I started with 4 other new nurses, and I was the last one to leave. That's how bad it was. I never in a million years thought I would be in home care when I went into nursing. I wanted to be in the hospital. Hospital nursing is the best nursing out there, but you just can't do it. And you can't do it and then come home to 4 kids. It's impossible. And those that do it are better humans than I. Corporations now, it's all about the line item, isn't it? Well, the biggest line item is nurses, probably followed by lawyers, if lawyers isn't now larger than nurses. And that's what it is. You do the budget and you want to get rid of the nurses. Medical errors is the 3rd leading cause of death in the United States, the 3rd leading cause. John Hopkins said 251,000 people die from nursing errors. What if we all walked around with a camcorder on our badge where you could actually see what we have to do every time, which every time you do wound care and somebody has 4 or 5 wounds and you're supposed to wash your hands and change your gloves after every single wound that you dress, but you can't possibly do that. You cut corners because you have to go see that next patient. That last time you took their blood pressure, it was starting to go down, and you're not even thinking about these wounds. You're thinking about that patient that might be going bad in the bed next door. That is what happens all the time in the hospital. It's your loved ones. So when we're talking about ratios, let's not talk about what the American Hospital Association wants. Let's not talk about what the American Nurses Association wants. Let's talk about what our patients of Connecticut deserve. Our patients in Connecticut deserve the absolute best care, and they deserve not to die when they're in the hospital. And those nurses deserve to be the best possible advocates. And Dr. Nurse Linda Aiken did do a study. She is from the University of Pennsylvania School of Nursing, and she specializes in outcomes. She looked at California and Australia, since both California and Australia are the only 2 places where she can get data because they have nurse-patient ratios, and patient outcomes improved. Senator Summers even said that. Oh, patient outcomes can improve, but there is no but. We want best patient care. So, and also nursing morale improved. So if you're going to vote against this bill, you are voting against all 50 of those nurses, many of them part of a union, who know that they are protected when they go back to work, and their nurse manager and the director of nursing isn't too happy that they came and testified. And when you're talking about mandatory overtime, it was stated by one of the people that came and testified that they don't have mandatory overtime at their hospital. But if you say no to staying an extra shift, then that's a patient abandonment. That's called threatening the nurse. So all of this is what the nurses are asking for. And guess what? We've been asking for it for a really long time. But now we all think you guys really like us. Now we're all heroes, aren't we? We're all heroes. We were the ones that got everybody out of COVID. And so now we actually feel like we might have a little bit behind us, that you're all going to support us. So if you vote no on this, you are voting no against all of those nurses that came to speak to you. You are voting no about improving patient outcome. You are voting no to nurses unions, which has been the best thing that ever happened to nurses. So I will be voting yes, and I will be voting yes loudly. And I will try to talk all those who didn't vote yes to please really, you know what, go to a hospital, spend 12 hours in an ICU and really see what happens. We saw what happens when people went to the safe consumption sites and they actually saw, holy cow, look at this, it's awesome. go to an ICU and see what it's like to be a nurse in an ICU. So I know I get passionate about that. I'm not going to apologize for my passion because I wanted to be here and I wanted to be the voice for nurses. And I am just so thrilled that I get to be the voice right now at this moment for this incredibly important bill. So I thank you for listening to me, and I certainly hope we all vote yes. Thank you.
Thank you, Senator Marks. And I think the passion that you feel is what we heard when we had the testimony. There's a lot of passion on this issue on many sides. I'm going to go next to Representative Claritas Detria, followed by Rep. Zupkis, followed by Senator Summers, followed by Senator Gordon.
Thank you, Madam Chair. I want to make it crystal clear with my comments. I do appreciate everything nurses do. And I think everybody in this committee, in this state, in this country, they're a vital, vital part of our medical team. They keep us safe. They help us out when we're in bad ways. But to say, I feel a little insulted that someone would say that we're trying to use a scare tactic. We're trying to use facts. Our job here is to talk these things out. We don't have to agree all the time, but we go back and forth trying to get our facts straight, trying to improve on different bills. One of the things we just found out, the state workforce report said we have 1,900 graduates coming, nurses graduating, but we have 3,000 openings in the state of Connecticut. So do the math. We have a nursing shortage. That's part of the problem. We need to address our nursing shortage. So I want to say, to the chairs and to this committee, I want this to work. It doesn't go into effect into 2028. What's it going to do for our nurses that are struggling today or tomorrow? Nothing, because we have a nursing shortage. We have to do what we can to get more nurses into the hospitals. So today I will be a no, and I think that's okay because it is a big work in progress. Thank you, Madam Chair.
Thank you, Representative Claritas Detria. I think one thing we all share is trying to see what we can do today. And we're going to be addressing that not just through this conversation, but in other bills as we have, and we will be. And we are all committed to continuing that work. Representative Zupkis to be followed by Senator Summers, to be followed by Senator Gordon.
Thank you, Madam Chair. And I agree with what all my colleagues said. There is not one person in this room, in the state, country, that does not believe our nurses are vital. So with the remarks that were just said, I too take offense because my no vote is not against nurses. My no vote is to hope this language gets better, hopefully to get better pieces into this bill, to have a little more flexible in the flexibility to those ratios. Could not be a nurse. And to every nurse in this room and out there, thank you, because you've taken care of me and my family and done a wonderful job. And you need help. I could never be a nurse today or any day. And when I sat here in person until 2:58 in the morning when the hearing ended, and all of the nurses, most of the nurses that I heard from came from one hospital. And what I would suggest is that this committee talk to DPH or CHA and look into that, because that is a problem to me. When most of the people that came and testified came from one hospital. And I asked those nurses, the president of that hospital and the union head, those questions. No one could give me an answer as to what's going on in that hospital. So that would be my suggestion. And again, my no vote means nothing against nurses. Thank you.
Thank you, Representative Zupkis. Senator Summers to be followed by Senator Gordon.
Yes, good afternoon now. I think it's important in light of the passion that you heard that we put this into context, and anybody on this committee can and should feel comfortable voting how they feel fit. Some of us will be voting no because the language needs to be changed in this bill. That does not mean that you're voting against nurses. It does not mean you don't appreciate nurses and the work they do. I come from a family of nurses. We have heard about nurses having issues, and we have helped with nursing issues over the last 8 years that I've been on this committee. But we have been addressed by the Connecticut Nurses Association with some very practical, real-time solutions to now. And those really need to be incorporated into this bill. And in order for us to have a successful bill going forward, where we can have all parties on board so that this has an opportunity to be positively voted on in the House and the Senate, this bill needs more work. So for those who are voting no today because this bill needs more work, there's language that has been addressed with some clear and really precise steps that we can take to help the situation now. I think that's a very prudent decision going forward. So I don't want anyone to be intimidated by what you have heard today to not cast a no vote. A no vote does not mean, again, that you are against nurses. Everyone in this committee and probably through the legislature and the state appreciates the difficult job that they have. And I just wanted to make that clear. And I also wanted to make clear, when we are elected as officials, we are elected to represent our district and the citizens of Connecticut. We are not elected to just represent one group. And I think that's important to point out here today. Thank you.
Thank you, Senator Summers. So I'll just take a moment to pause us. I think, again, as I said, a lot of passion around this issue. And this happens when we heard from folks on Wednesday, and we see that here. And I think we each bring our personal experiences to the table as we represent who we represent, and we each bring our passion and our desire to bring the best product forward. We will all express that differently, and I, as always, appreciate the conversation and the dialogue here, and we'll continue with Senator Gordon and then to be followed by Representative McCarty.
Thank you, Madam Chair, and I do appreciate the passion that my colleague and friend Senator Marks has. However, I do take exception to what was said, that if one were to vote no, one is voting against nurses. I don't see it that way whatsoever. In fact, if I were to vote no, it's because I'm voting no on existing wording, especially about ratios that don't make any sense for the here and now. And what I've been hearing during discussion at this committee supports what I've been saying, what others have been saying, that enacting ratios that don't go into effect until 2028 does nothing for the issues at hand now. We have no idea what will happen in 2028. We should be looking at things that can be of help now and in the near future. And again, I want to cite some wonderful proposals that really can move discussion and work forward that have been brought forward by the Connecticut Nursing Association. I think there are things that we can be moving in certain directions to flesh things out. So even if I vote no because we don't have any change in wording and I have to go with wording that's in this bill as it is here and now, doesn't mean that I don't support nurses. Throughout my professional career, I have advocated for nurses. They're a very important part of the patient care team. And I think it behooves us as elected officials in the state of Connecticut to do what we can do, working together and working with nurses and working with the hospitals to find some realistic, responsible, and meaningful ways forward now, so to speak, as opposed to waiting for 2028. So even if I vote no on this, it doesn't mean I don't support the efforts, and I will very much publicly offer here and now to do what I can, working with people on this committee, chairs and ranking members, to see what we can do to deal with further wording on this bill to try to be of help to nurses everywhere in this state, just not certain parts of the state. Thank you.
Thank you, Senator Gordon. We next have Rep. McCarty to be followed by Rep. Cook, then Rep. Dauphiné.
Thank you very much, Madam Chair. I'd just like to add my comments. I agree with Dr. Gordon that unfortunately, we heard the issues and we know, at least in my opinion, we do have workforce shortages. That's where I'm holding back. If the language in line 28 was modified somewhat, that we don't restrict the mandates out, the ratios in 28 till we see what kind of incentives that we know throughout the building. We're putting in all kinds of proposals to recruit more nurses. We have pathways going. So I would be more comfortable if those guidelines were mandated when we know exactly where we are with the workforce. That's somewhat my holdup, but I also agree with the comments that we need to do something now to help the nurses that I don't quite know what that solution is. I think working with the committee to see what can be done currently to alleviate some of the stresses, but I do have an issue with mandating the ratios out. Mine's a little different than Dr. Gordon, that he's ratios currently, but I'm looking out at 28. We don't have that full data yet to understand what we could do. This would be good to say, these are the guidelines we are hoping we can achieve once we solve the workforce issue. So I just want to put out there that I do respect our nurses and the tremendous work that they're doing, but I have some conflict not knowing that if we find some solutions now, but don't say what the guidelines have to be in 2028 till we have all that correct information. Thank you for allowing me to express my concerns.
Thank you very much, Representative McCarty. Representative Cook to be followed by Representative Dauphiné. And then
Thank you,
Senator
Madam
Marks.
Chairman. You know, I sit here with confliction because I believe that we do have different points of view on a no to flag or a yes to support. And I think that we really need to figure out how we move forward on this and what we need to do. And I think that the most important component of what we do is listening to the folks that are on the job doing the work. I have a daughter that is a nurse. I'm sitting next to a nurse and we have more around the table. And I believe that it's very difficult for us to tell a profession what they need if we're not in the profession, but we need to listen to that profession and do what they're asking for. They are in dire straits. And I know that in 2020, when my father-in-law passed away due to COVID in an ICU bed, it was a nurse that held his hand. And it was the nurse that was on the phone with us so we could say goodbye to a man that she was inevitably saying goodbye to for us. That is not a pain that I would want to inflict on anyone. And I don't believe that this piece of legislation goes far enough. I don't think that it is immediate enough. And there is a cry for help. And so I hope that when we do whatever we're going to do with this piece of legislation, that we make it better and we make it better for them. Because there are millions of people out there that were affected by a pandemic. Tens of thousands of nurses that were surrogate family members to help family members say goodbye to folks. They're crying for help. We need to help them. And so for me, I want to be able to help them. And I want to be able to work on this piece of legislation. And if this piece of legislation dies in this committee, we do not get the opportunity to do that. And so for me, I will be a yes to continue to work on this legislation because I think it is so vitally important that the nurses that give each and every day, the medical professions that give each and every day, we need to listen to them and we need to give them what they're begging for. Because at the end of the day, we're going to be in a crisis again, and we're going to need to know that we can count on them. Thank you, Madam Chair.
Thank you, Representative Cook. We have next Representative Dauphiné to be followed by Senator Marks and Senator Kushner.
Thank you, Madam Chair. And I couldn't go without making a few comments. I think many of you know I've been a nurse for almost 40 years, about 37, and I've worked in many, many facets of nursing, including acute care, hospice, cardiac step down, orthopedics, camp nursing, school nursing, home care, you name it, I've done it. And I've seen the shortage wax and wane. I've seen the situation in the hospital. I can tell you my experience was that they did everything they could to make sure that we were adequately staffed. And sometimes, you know, they're the powers that be that kind of are very difficult to address. But I will say that last year I was approached by a union leader and a group of nurses who asked me for this bill. And their quote unquote statement was, our union won't do it for us, so we need you to put it in statute and make it regulated and mandated. And that's what we heard from. We heard from a majority of union nurses from Danbury Hospital who wanted this bill to pass. And the ones that we heard from that didn't come from Danbury, there were various testimonies, many of which talked about the unintended consequences of what this bill will bring. And that's what I'm really, really concerned about. Whenever there's a mandate, we always get unintended consequences. And then, then it's even harder to repeal and work through. One of the nurses that spoke also worked in a place that did mandated staffing and one that didn't. And she spoke about the difference and unequivocally talked about her hands being tied on those that had mandated staffing regulations. And she did say that the shortages did not improve once they put that in place, which I think has been over 5 years now, which is one of the arguments that they've made, is that it will improve if we put these regulations in place. I will not tell anybody how to vote, nor make you feel guilty for how you're voting. And I won't take it as a vote against nurses or for nurses. I am completely 100% for nurses. And obviously that's my career, and I feel for them and I know how hard they work, but I just felt like I needed to make a comment about that. Thank you, Madam Chair.
Thank you, Representative Dauphiné. We have Senator Marks to be followed by Senator Kushner.
Thank you. I'll go quickly, Madam Chair, through you. We don't have a nursing shortage. We have nurses who won't work at the bedside. And by passing this bill, you give those nurses hope. If we were to change it, the 2028 was actually a compromise with the Hospital Association to give it a little bit more time. If this committee wants to make it sooner, I can guarantee you that the nurses at the bedside will be thrilled. This was their compromise, because they do compromise. These ratios there's no teeth in these ratios, but it's a place to start that gives flexibility. And people don't want ratios, but yet I heard Commissioner Bai yesterday on one of the Sunday political shows that talking about daycares, and where you have to have one teacher for 4 infants in the daycare setting. And I think everybody here and everybody in the audience and listening would say, absolutely. Like, how can you take care of more than 4 infants at one time? Well, people in a hospital bed, people that can fall, med errors, it's all the same. They're really not asking for all that much. And I do ask everybody to please look up Linda Aiken's research. It is, it's best practice. She's brilliant. It's really, really good research, and the outcomes improve. And the bottom line, that's what it's all about. The bottom line is making sure our patients have the best care. And we don't want medical errors to continue to be the third leading cause of death for people in the United States. So just the ratios are flexible, and there is no nursing shortage. We have nurses that have left or that will no longer practice at the bedside.
Thank you, Senator Marks. Excuse me. See, I keep doing this because I just want her in the house. But Senator Kushner to be followed by Senator.
Thank you. Thank you, Madam Chair. And I love sitting next to you, and I don't care if you call me a rep or a senator, it doesn't really matter. I want to say a couple of things about generally ratios and staffing shortages, staffing problems they really have existed so much longer than the pandemic. And I appreciate that the pandemic made it much more acute, and it made us much more aware of the problem. But it's been going on for a very long time. And I appreciate the comments that have been made about changes in hospital care and consolidation and private equity, and changes that happen in a lot of spheres in our society, but probably don't hit us as hard as within the healthcare industry, because that hits each one of us, because we all want to be taken care of by that doctor or nurse that we know for years and we care about. And I know, just on a personal level, I remember leaving a medical practice in my community because it changed so much because it had been bought out by the hospital. And they no longer allowed me to have those conversations with my doctor. And everything was, there was nobody to talk to if I called during my lunch hour because they were on lunch hour. It just so many changes that we've seen over the last several decades. So this is a longstanding problem, and I really appreciate the fact this committee is trying to address this problem now and looking forward to the future, how we can make it better. The only other thing I want to say is that, and one last thing on the question generally, I know it was Massachusetts was talked about, and I have a family member who was very deeply involved in trying to get staffing ratios in Massachusetts and told me how devastating it was that referendum failed. And he also told me how much money was spent by the hospitals to defeat that referendum vote. And what we thought was that people would trust their nurses, and we found that the money that they were up against was just too much. And so I'm glad we don't have that system in Connecticut and that we can do it in this much more, I mean, at least on this issue, I'm glad we don't have that system. I'm not going to say in every case I would feel that way, but I think it's better that we have this opportunity to do this through the legislature. I just want to say a thing or two about Danbury, because I represent Danbury. And I heard almost all of that testimony the other night. And I also heard the president of the hospital. And what I said to her that night was that I recognize this isn't, you can't look at this in just like as one little piece of the hospital's value, because our community really cherishes the hospital and what they do for us to keep us safe and to keep us healthy. And while there are many problems, we can't write off Danbury Hospital or Newvance and say it's a disaster. There are problems, serious problems, but I recognize how important the hospital is to our community. At the same time, I ran into the president a few days later, and she was appreciative of those comments. And we are able to continue the dialogue. We're not at war. We have to continue the dialogue. I left where I ran into her and went to a meeting with the nurses at Danbury Hospital. And I will tell you, they were very appreciative of their union and the support they got to be able to come and testify. I don't believe Danbury Hospital is the problem. I don't think it's that exceptional. I think these problems go beyond Danbury. I think the nurses at Danbury organized to express themselves, and they had tremendous support from the union to make that happen. And I don't think it's a Danbury problem. You know, I think it's a problem in Danbury, but it's not just Danbury. And so I just wanted to be on the record as supporting the hospital because it's so important to our community, but absolutely, as I said that night to Sharon Adams, I support the nurses on this bill because I think it's critically important that we move forward. Thank you.
Thank you, Senator Kushner and Senator Summers, to be followed by Senator Almar.
Yes, I just want to, I think it's important that we clarify the record here. And there was statements made that this bill is a compromise with the hospitals. That is not true. CHA has not compromised. This is not compromise language for them. They have made it very clear that they cannot compromise on staffing ratios. So that is just not an accurate statement. And the other thing is, there may be somebody on this committee that doesn't think that there is a nursing shortage, but all the studies that we have through DPH over the last 11 years show that we have a nursing shortage in the state of Connecticut. Even if all these nurses that were referred to as leaving the bedside came back, we would still have a nursing shortage. So I don't want anyone leaving this meeting tonight thinking that there is not a nursing shortage, or actually this afternoon, Freudian slip there, but there is actually a nursing shortage. So I want to make sure that those two things are clarified for the record. Good, bad, or indifferent, that's the record. So I wanted to make sure that that was clarified. So thank you.
Thank you, Senator Summers. Senator Almar.
Thank you, Madam Co-Chair. So a lot has been said. I just wanted to put things in perspective for a little bit for all of us. what has happened is it's the bedside nurses where the challenges are. It's very difficult to be a bedside nurse. And if people have not heard, a few months ago, I think NPR did a story. One of the most dangerous jobs in America is a bedside nurse, because if you're not physically hurt by an abusive patient or confused patient, you are likely to have your back injury before you're 40 years of age, because it's almost impossible to be able to move patients who have falls and other injuries, and you're helping them out. And also the challenges that they're facing with the number of patients that they have to see. All of those things have added to the point that nurses are moving into administration, or they are going for advanced training. And the even though the total number of nurses are there, as Senator Marks is accurate when she says that there are enough nurses, but when we look at the bedside nurses, that is where the shortage is, because it's almost next to impossible to be a bedside nurse in a sustainable manner. And that's frankly as soon as you think of a nurse, you think of the bedside nurse. That's the reaction you have in your mind. And that's part of our collective responsibility, is to protect this important profession. And as we are going through a disaster situation in the healthcare field, there are multiple prescriptions to this. One of those prescriptions is to actually increase the number of nurses by having increased training incentives. We have a bill for that. We are looking at that. That has to be done. We are also trying to identify ways to make it easier for a nurse from another part of the country to come to our state. We are working on that. We have had conversations with DPH, and they have actually expedited, and they can get nurses who are willing to come here to be able to be taken care of. But the existing nurses and the ones that we are training, we have a responsibility to protect them and make sure that this profession is something that they can do the best that they want to do and they are passionate about. And that's why it's important to have a bill to put these things in together. Now, I know 2028 is too far away, but there are parts of the bill we actually can address right now. The committees aren't working. They're not universal. Some hospitals, they work, some they do not comprehensively. We have to almost put in a legislation again for the committees to work, to people to sit in a room to make sure that the ratios are working. They're not, because not every hospital is sane. And that's part of the difficulty that we have to have. So we have that part here. We also have the mandatory overtime. We cannot ask a nurse who has worked for 12 hours nonstop to put in another 8 hours when they have family members at home who have needs. They are physical needs that they may have themselves, and it is emotionally traumatic. And that's where we have a responsibility to create those protections. Now, there are bad actors. There are challenges, and I've had frank conversations with our Connecticut Hospital Association. I respect them. I want to help them, but I told them that not at the cost of nurses. So we will work with you, but we want to make sure that the profession of the nurses and the bedside nurses are taken care of in this effort that we do. And I think that's the most important thing that we have to keep in mind in this bill. The bill is not in the final version at this time. It will continue. We'll have those conversations, and passionate conversations. The hospitals are going through a very difficult time in their history as well. They're trying to survive after the pandemic, and everybody has an image of, as Representative Steinberg has said, that we are looking at in our minds the two largest hospitals and think every hospital is doing well. No, it's not true. Not every hospital is doing well. Some are close to being closing down. So we have to protect them as well. But we have to make sure that many of the other bills which are harmful to the healthcare systems, they have to be addressed. We have to protect them from some of the harmful bills for healthcare systems, but this is not a harmful bill to the healthcare systems when you're trying to take care of the nursing staff. So I would just urge everybody to continue this conversation, move forward. Let's vote on this bill and vote yes or no. I would want more people to vote yes, because this is work in progress. That's why I would say that vote yes, so that we can continue the conversation and come up with a compromise, not as much on the part of the nurses, but somewhat on the part of the hospital. That's how I see it. Thank you, Madam Co-Chair.
Thank you very much, Senator Almar. We've had a lot of lively discussion here on this issue today, and I think that Senator Almar, you put it well, that we will remain in conversation around this issue. We all know that we need to help the helpers. You've heard me say this here over and over again, and we heard very clearly from our nurses, and we heard different perspectives from other nurses in management, and we are going to continue the conversation with our nurse leaders, with our hospital administration, and together with members of this community to do whatever we can to make sure that those who are helping us in our most vulnerable moments have what they need to help us. So with that, Madam Administrator, would you kindly call the roll?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy Vahey,
Representative McCarthy Vahey votes yes.
Senator Kushner,
Senator Kushner votes yes.
Senator Marks,
Senator Marks votes yes.
Representative Parker, Senator Summers, Representative Clarice Detrier,
Representative Clarice Detrier votes no.
Representative Belton, Representative Berger Givallo,
Berger Givallo votes yes.
Senator Cabrera, Representative Carpino, Representative Cook,
Representative Cook votes yes.
Representative Dauphiné,
Rep. Dauphiné votes no.
Representative DiCaprio,
Representative DiCaprio votes no.
Representative D'Amico,
D'Amico votes yes.
Representative Denning,
Representative Denning votes yes.
Representative Elliott, Representative Foster,
Rep. Foster votes yes.
Representative Django,
Representative Jenga votes yes.
Representative Gilchrist, Senator Gordon,
Senator Gordon votes no, but very much looks forward to an approved bill.
Representative Cabris DeGraw,
Cabris DeGraw votes yes.
Representative Kitt,
Representative Kitt votes yes.
Representative Kennedy,
Kennedy votes no and looks forward to our final verbiage.
Representative Linehan,
Linehan votes yes and trusts the chairs. Thank you.
Representative Morrow,
Representative Mara votes no.
Representative McCarthy,
Representative McCarty votes no.
Representative Pond, Representative Carrillo,
Carrillo votes no.
Representative Rader,
Representative Rader votes yes.
Senator Rahman, Representative Reddington Hughes,
Representative Reddington Hughes votes no.
Representative Ryan,
Representative Ryan votes yes.
Senator Slack, Representative Steinberg,
Representative Steinberg votes yes.
Representative Wielander,
Representative Wielander votes yes.
Representative Zupkis,
Representative Zupkis votes no.
Senator Summers, Representative Belton, Senator Cabrera, Representative Carpino, Representative Elliott, Representative Gilchrist, Representative Pond, Senator Rahman, Senator Slack. Thank you, Madam Chair.
Thank you, Madam Administrator. Votes will be held open until at least 5, though we'll reevaluate if the need arises, just to make sure. Before we move on to item number 3, I just want to make sure that we also did a shout out. In the beginning, we did thank yous, and I want to make sure that we thanked Nick Panzarella, who's also one of our LCO attorneys. I think Senator Anwar said, but just in case, I want to make sure that we got him as well. We appreciate everyone so much. There would be no bills without you. Item 3 is Senate Bill 1073. That's an act requiring the administration of epinephrine by first responders. This is a JF to the floor. Is there a motion?
So move.
Moved by Senator Anwar. Is there a second? Seconded by Senator Kushner. Senator Anwar, I'm going to turn this one over to you.
Thank you so much, Madam Co-Chair. This again is a pretty straightforward bill. As you may have heard about a few pretty sad incidents in our state in the testimony where somebody was having an anaphylactic shock and the first responders did come. And as the first responders came, they did not have an EpiPen and the patient died. This is something that's preventable. We have passed many times bills in the past, but we have not necessarily been able to get to the point where all the various first responders are able to come with an EpiPen. This bill will address that responsibility that we have towards our citizens. And there are parts of some groups that have some concerns about it. We want to move forward and pass this bill, and we are open to having conversations with anybody within the first responder groups if they have any specific question that we can address. But today, Madam Chair, let's make sure that we don't have people dying from bee stings or food anymore, even when they call EMS. Thank you so much.
Thank you so much, Senator Anwar. Questions or comments? Is there discussion on the item? All right. No. All right. Well, I'll concur again. This was, oh, there we go. Representative Dauphiné.
Hi, thank you, Madam Chair. I just wanted to confirm that we're talking about injectors that have unit dose measurements in them, that there won't be any measuring of the epinephrine. I know that was a concern from EMR, and that was my question with regard to that. And then my other concern was that we're mandating this medically, and I'm just concerned that perhaps this should be a recommendation and a permissiveness, and that they would direct within their own facilities how they're going to handle this. Thank you, Madam Chair.
Thank you, Representative Dauphiné, for that very important question. This is about having the pre-measured auto injector not to be drawn by an individual. So that's what the bill is addressing. And we have the permissive language, and the permissive language has not been able to make a difference, unfortunately. And that's why we have to mandate this. Thank you.
Thank you, Representative Dauphiné, and thank you, Senator Anwar. Representative Claritas Deetria.
Thank you, Madam Chair. I'd like to also check, will the EMS organizations be able to buy these in a bulk form for a better price if they're getting it in bulk?
The bill is not looking at or helping that component. It's silent to that part.
Thank you, Mr.
Thank
Chair.
you.
Thank you, Representative Claritas Deetria, and thank you, Senator Anwar. Seeing and hearing no other discussion, Madam Administrator, would you kindly call the roll?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy Vahey,
Representative McCarthy Vahey votes yes.
Senator Kushner,
Senator Kushner votes yes.
Senator Marks, Representative Parker, Senator Summers, Representative Claritas Deetria,
Representative Claritas Deetria votes yes.
Representative Belton, Representative Berger-Givallo, Senator Cabrera, Representative Carpino, Representative Cook,
Representative Cook votes yes.
Representative Dauphiné,
Rep. Dauphiné votes yes.
Representative DiCaprio,
Representative DiCaprio votes yes.
Representative D'Amico,
D'Amico votes yes.
Representative Denning, Representative Elliott, Representative Foster,
Rep. Foster votes yes.
Representative Jango,
Rep. Jenga votes yes.
Representative Gilchrist, Senator Gordon,
Senator Gordon votes yes.
Representative Cabarrus DeGraw,
Cabarrus DeGraw votes yes.
Representative Kitt,
Representative Kit votes yes.
Representative Kennedy,
Kennedy votes yes.
Representative Linehan,
Linehan votes yes.
Representative Morrow,
Representative Mara votes yes.
Representative McCarthy,
Representative McCarty votes yes.
Representative Palm, Representative Perillo,
Perillo votes yes.
Representative Rader,
Raider votes yes.
Senator Rahman, Representative Reddington Hughes,
Reddington Hughes votes yes.
Representative Ryan,
Representative Ryan votes yes.
Senator Slack, Representative Steinberg,
Representative Steinberg votes yes.
Representative Wielander, Representative Zupkis, Senator Marks, Representative Parker, Senator Summers, Representative Belton, Representative Berger Giballo, Senator Cabrera, Representative Carpino, Representative Denning, Representative Elliott, Representative Palm, Senator Rahman, Senator Slapp, Representative Wielander, Representative Zupkis.
Representative Zupkis votes yes.
Thank you, Madam Chair.
Thank you, Madam Administrator. Moving on to item number 4 on our agenda. This is Senate Bill number 1210, an act establishing a task force to study issues concerning rural health. This is a JF to the floor. May I have a motion?
So move.
Moved by Senator Amor and seconded by Representative Cook. Is there discussion on the item? Well, actually, excuse me, just for one moment, we'll do a quick summary of the bill and then we'll have discussion. Senator Amor.
Thank you so much, Madam Chair. This bill is based on some of the challenges that we have heard from many of the community members in the rural parts of our state. You'll probably hear that on the EMS bill as well, where and in the healthcare facilities, we are all aware of many of the rural areas of our state where the women's health issues have the coverage has decreased. The number of clinicians available have decreased. The healthcare quality is not the same level at times, and very few the healthcare systems are going through some challenges, and that's why it's important to have a conversation to broaden the services and have a critical mass of individuals who are going to be able to participate and address some of this going forward. So that's what this bill is about, and the committee will share the recommendations with us by January 1st, 2024.
Thank you, Senator Amor. Discussion on the item, Representative Zupkis to be followed. Well, we're going to go with Representative Zupkis.
Thank you, Madam Chair. And I really appreciate this bill because I have, part of my district is rural. And a lot of my colleagues, even as I look around, have a lot of rural towns in their districts as well. And when I look at this task force, it's a little unbalanced. I know even though being in the minority, I find it's really 8 of the majority party and 2 of the Republican Party. And what I would ask as a change, and I bring this as a friendly amendment, is to have the Speaker of the House and the President Pro Tem of the Senate, instead of 2 appointments, having 1 appointment each, and also giving each of you chairs an appointment and the ranking members. And there'll still be majority, but it'll be a little more balanced and bring that rural, really those towns that are represented by the rural representatives and senators into this picture. I would like to make sure this amendment is subject to LCO technical and conforming changes. Thank you.
Thank you, Representative Zupkis. So I hear you have made, are you making a motion?
Yes, making a motion to accept my friendly amendment.
So there's a move for an amendment. Is there a second? Seconded by Representative Clara DeStitria, Senator Amor.
Thank you so much, Madam Co-Chair. I accept that as a friendly amendment.
Wonderful. Is there a point of order or point of clarification or discussion? Representative D'Amico.
Just a point of clarification, Madam Chair, could I hear the amendment one more time so that we
In-
could all hear it one more time? Thank you.
Indeed, I will ask the proponent of the amendment to just repeat that for us. Rep. Zupkis.
Yes, thank you. So what this amendment would do is to take the Speaker of the House and the Senate Pro Tem, instead of 2 appointments each, they would get 1 each, and we would have the 2 chairs and the 2 ranking members have an appointment for each.
Thank you, Representative D'Amico. Is there further discussion on the amendment only? Seeing and hearing none, we will have a voice vote. Anyone on Zoom prepare to vote? All those in favor of the amendment, please signify by saying aye.
I,
Any opposed? The amendment passes, so we will return to the bill as amended. Is there further discussion? Senator Gordon.
Thank you, Madam Chair. Coming from the northeast part of the state, I do represent a number of small and rural towns, and I've also myself practiced in rural settings. So I appreciate very much this being brought forward as a bill, and I very much look forward to seeing what this task force can do. There are a lot of important issues specific to rural towns. I know Senator Anwar, you had mentioned about women's health, and that is one of those aspects, which I do share as a concern about availability in rural towns. And there's a number of other services as well. I know our hospitals that cover those areas are doing the best they can. And I think there's things we can look into to what we could responsibly see about what this committee at a future time might be able to do to be of help. So thank you very much.
Thank you for that, Senator Gordon. Representative Cook.
Thank you, Madam Chairman. And I'm not going to make an amendment to this, but I do want to say that I would like to maybe see something moving forward between now and when we vote on this on the floor. I would like to see a halt, if you will, on any decrease in coverages until we can get this task force working group completed. I think at the end of the day, there's so many moving parts and it happens so very fast that we can end up losing 3 or 4 different types of services in these neck of the woods. If we don't put a hold on that until we finish doing our work with this working group. I'm just suggesting that as we move forward, not for today. I'd like to, so business can move, but I think that it's vitally important and that the rural parts of our state and the residents that feel like they're being targeted and losing their coverages recognize that we hear them and that we would like to keep the coverages that they have, no less. If you want to add more, that's great. But no change in a decrease in coverage until we can get this working group done. Thank you, Madam Chair.
Thank you, Representative Cook. And I believe your comments really underscore the importance of this group and this conversation for our state. Seeing and hearing no other discussion, Madam Administrator, would you kindly call the roll?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy Vahey,
Representative McCarthy Vahey votes yes.
Senator Kushner,
Senator Kushner votes yes.
Senator Mark, Representative Parker, Senator Summers, Representative Clara DeStitria,
Representative Clara DeStitria votes yes.
Representative Belton, Representative Berger Givallo, Senator Cabrera, Representative Carpino, Representative Cook,
Representative Cook votes yes.
Representative Dauphiné,
Dauphiné votes yes.
Representative DiCaprio,
Representative DiCaprio votes yes.
Representative D'Amico,
D'Amico votes yes.
Representative Denning,
Representative Denning votes yes.
Representative Elliott, Representative Foster,
Rep. Foster votes yes.
Representative Jengo,
Representative Jenga votes yes.
Senator Gordon,
Senator Gordon votes yes.
Representative Cabros DeGraw,
Cabros DeGraw votes yes.
Representative Kidd,
Representative Kit votes yes.
Representative Kennedy,
Kennedy votes yes.
Representative Lenahan,
Linehan votes yes.
Representative Morrow,
Representative Mara votes yes.
Representative McCarthy,
Representative McCarty votes yes.
Representative Palm, Representative Perillo,
Perillo votes yes.
Representative Rader,
Representative Rader votes yes.
Senator Rahman, Representative Reddington Hughes,
Reddington Hughes votes yes.
Representative Ryan,
Representative Ryan votes.
Senator Slack, Representative Steinberg,
Representative Steinberg votes yes.
Representative Wielander,
Representative Wheelander votes yes.
Representative Stopkis,
Representative Zupkus votes yes.
Senator Marks, Representative Parker, Senator Summers, Representative Belton, Representative Braga Givallo, Senator Cabrera, Representative Carpino, Representative Palm, Senator Rahman, Senator Slack. Thank you, Madam Chair.
Thank you very much, Madam Administrator. Moving on to item 5 on our agenda, Senate Bill number 1211, an act establishing a mental health crisis center pilot program. This is a JF to the floor. May I have a motion?
So moved.
Moved by Senator Kushner. Is there a second? Seconded by Representative Wheelander. This bill is fairly self-explanatory in the title. It would require DEMIS to actually, and together with TCF, to establish a mental health crisis center pilot in one region. And this is really geared towards helping take some of the pressure off of our hospital emergency rooms as we see the need has increased and towards another facility, and requires the report to come back. Excuse me, is there discussion on the item? Representative Claritas Deetria.
Thank you, Madam Chair. Do we know what the criteria will be, how we'll pick the one region?
Thank you, Representative. DEMIS will determine where that program will be located.
And will we, are we currently doing anything similar to this in the state of Connecticut?
Thank you for the question, Representative. Not that I'm aware of. I think we are trying with this bill and some others to create some, as I said, pressure relief for what we're seeing in our hospital system. So, but not that I'm aware of.
Thank you, Madam Chair.
Thank you, Representative. Representative Dauphiné.
Thank you, Madam Chair, and I think Representative Claritas Deetris answered, asked my question, but I was asking about redundancy, and I'm always concerned that we might be piling on, and while I'm supportive of mental health support, I don't want to see us overlapping and have a greater cost to the taxpayers.
Representative Dauphiné, I apologize, Representative, I'm just going to interrupt you. Having a little bit of trouble hearing you here in the hearing room. If you can just repeat what you said, that would be wonderful.
I'm sorry, I was saying that I was asking the same question that Rep. Beatrice asked, so I will just end it there. Thank you.
Thank you, Representative Dauphiné. And I see Representative McCarty.
Thank you very much, Madam Chair. I would just ask that as this moves forward, that they might look at United Way with the 24/7 211 crisis center, that they do offer mental health crisis support and help with counseling. So anything learned from United Way, this may help with a new pilot program. Just to offer that as a suggestion.
Thank you, Representative McCarty. And just by way of clarification, are you referring to the mobile crisis response teams or is there something in addition?
Yes, and in addition to that, the United Way does work with mental health counseling and support services, so it might be something to look at. Thank you.
Thank you, Representative McCarty, and I always appreciate your input when it comes to these items and your experience and appreciate that idea of being additive and complementary to build on the foundations that exist already. I thank you for those comments. Is there other discussion among members of the committee? Seeing and hearing none, Madam Administrator, would you kindly call the roll?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy Vehy,
Representative McCarthy Vehy votes yes.
Senator Kushner,
Senator Kushner votes yes.
Senator Marks,
Senator Marks votes yes.
Senator Summers, Representative Clara DeStria,
Representative Claire DeStria votes yes.
Representative Belton.
Representative Belton votes yes.
Thank you. Representative Berger Givallo,
Berger Givallo votes yes.
Senator Cabrera, Representative Carpino, Representative Cook,
Cook votes yes.
Representative Dauphiné.
Rep. Dauphiné votes yes.
I did not see you on screen, please.
Rep. Dauphiné votes yes.
Thank you. Representative DiCaprio,
Representative DiCaprio votes yes.
Representative D'Amico,
D'Amico votes yes.
Representative Denning,
Representative Denning votes yes.
Representative Elliott, Representative Foster,
Rep. Foster votes yes.
Representative Django,
Rep. Jenga votes yes.
Senator Gordon, Representative Cabras deGraw,
Cabras deGraw votes yes.
Representative Kidd,
Representative Kidd votes yes.
Representative Kennedy,
Kennedy votes yes.
Representative Linehan, Representative Morrow,
Representative Mara votes yes.
Representative McCarthy,
Representative McCarty votes yes.
Representative Palm, Representative
Palm
Perrello.
votes yes. Palm votes yes.
Thank you. Representative Perrello, Representative Rader,
Representative Rader votes yes.
Senator Rahman, Representative Reddington Hughes,
Reddington Hughes votes yes.
Representative Ryan,
Right, Representative Ryan.
Senator Slapp, Representative Steinberg,
Representative Steinberg votes yes.
Representative Welander,
Representative Welander votes yes.
Representative Dubkis, Senator Summers, Senator Cabrera, Representative Carpino, Representative Elliott, Representative Linehan, Representative Perrello,
Perillo votes yes.
Senator Rahman, Senator Slapp. Thank you, Madam Chair.
Thank you, Madam Administrator. Next is item 6. This is Senate Bill number 1228, an act concerning the state's healthcare workforce. This is a JFS to the floor, LCO number 6386. May I have a motion?
So move.
Moved by Senator Anwar. Is there a second? Seconded by Representative Belton. The workforce bill is, though it is S language, we expect will be a work in progress, probably through till when it comes onto the floor. And this is because, as we discussed earlier with the previous bill, our workforce needs support, attention, and all the help it can get at this point. So the bill itself addresses some healthcare licensure testing and other related issues. Specifically, it does require DPH to notify applicants taking an exam for licensure, certification, or registration that they may have testing accommodations. It also requires the dental hygienist licensure to be offered in both Spanish and English. And it requires that the Yukon School of Dental Medicine help to develop an exam that would parallel the national exam for dental assistants, specifically for taking dental x-rays. This would help address an issue of shortage, and I would like to thank Representative Cook, who had proposed this, and Senator Summers, who was advocating for this language that has been worked on by a number of our departments at the state level and will allow us to, again, bolster that workforce. The bill also will create some studies for us to be able to move forward in future sessions. It asks the Education Commissioner in consultation with Labor and Public Health to study the feasibility of establishing an interdistrict magnet school program to train students interested in the healthcare professions. Again, Senator Summers has been a proponent and supporter. And it also is a study to address the shortage of radiologic technologists, nuclear medicine technologists, and respiratory care practitioners. We will also be asking in this bill that the Commissioner of DPH study the feasibility of offering those competency tests in Spanish and English. So you can see that we're trying to expand that access. And finally, after hearing testimony that we did on Wednesday, asking that the Aging and Disability Services Commissioners, in consultation with the Advisory Board for Persons who are deaf, hard of hearing, or deaf-blind, to look at gaps in access of those, individuals' access to communication with medical providers so that they can be able to receive services and support. Is there discussion? Actually, you know what? Yep, that's all for now for me. Is there discussion on this item? Oh, Representative Zupkis.
Thank you, Madam Chair. This is a great bill, and I heard from one of my constituents. He is in the radiology tech, and they think this is a great bill. However, they just needed a little bit of a change because the way they their college, they have to have an associates in different things. It really would not do anything for them. So I will talk to you about that after, but I will be supporting it, and so do they. Thank you.
Thank you, Representative Zupkis, and I think you underscore that point that we will be probably making some tweaks on language for issues just such as that, and I appreciate that and look forward to getting that information from you. Representative McCarty.
Thank you very much. And I will be supporting the bill, but as I made some comments a little earlier today, that as we continue to put more requirements on the Department of Education, that we should be mindful of their staffing issues and the funding necessary. And then just and we know we have the workforce shortage, so we need to do everything we can to increase the incentives, but I think it may require a little more ongoing work if this does become possible, looking at the feasibility of a interdistrict magnet school that addresses the healthcare profession, that coming out of the program, I think in the bill it mentions licensure and certification, but we may just have to keep an eye on that. I'm very much in favor of building up those pathways in the career, but I'm not sure that you would be able to graduate from high school with a licensure. So I just wanted to put that out. Thank you.
Thank you. And as I said before, I am always grateful for your input. And one of the things that I think I'll take this opportunity to mention is that when we look at workforce, we know that our Higher Education Committee and our Education Committee are also focused on these issues. And as we pass these bills out of committee and they go to screening, we will be working with those other committee leaders to make sure that we are all rowing in the same direction and assuring that our departments are able to work in concert with one another to most effectively address these needs. So I appreciate you raising that very much. Is there further discussion on this item? Seeing and hearing none, Madam Administrator, would you kindly call the roll?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy Vehy,
Representative McCarthy Vehy votes yes.
Senator Kushner,
Senator Kushner votes yes.
Senator Marks,
Senator Marks votes yes.
Senator Summers, Representative Tiredus Detria,
Representative Claire Distria votes yes.
Representative Belton,
Representative Belton votes yes.
Representative Berger Givallo,
Rep. Burger Givallo votes yes.
Senator Cabrera, Representative Carpino, Representative Cook,
Cook votes yes.
Representative Dauphiné,
Rep. Dauphiné votes yes.
Representative DiCaprio,
Representative DiCaprio votes yes.
Representative D'Amico,
D'Amico votes yes.
Representative Denning,
Representative Denning votes yes.
Representative Elliott, Representative Foster, Representative Django,
Rep. Foster votes yes.
Representative Django,
Representative Jenga votes yes.
Senator Gordon,
Senator Gordon votes yes.
Representative Cavros DeGraw,
votes yes.
Representative Kidd.
Representative Kidd votes yes.
I did not see you on screen, please. Can you try again?
Yes, hold on. Representative Kidd votes yes.
Thank you. Representative Kennedy,
Kennedy votes yes.
Representative Linehan,
Linehan votes yes.
I did not see you on screen, please.
Oh, Representative Linehan votes yes.
Thank you. Representative Mara,
Representative Mara votes yes.
Representative McCarthy,
Representative McCarty votes yes.
Representative Palm,
Palm votes yes.
Representative Perrella,
Perillo votes yes.
I did not see you on screen, please.
Perillo votes yes.
Thank you. Representative Rader,
Representative Rader votes yes.
Senator Rahman, Representative Reddington Hughes,
Representative Reddington Hughes votes yes.
Representative Ryan,
Representative Ryan votes yes.
Senator Slack, Representative Steinberg,
Representative Steinberg votes yes.
Representative Wieland,
Representative Wieland votes yes.
Representative Zupkis,
Representative Zupkis votes yes.
Senator Cabrera, Representative Carpino, Representative Elliott, Senator Rahman, Senator Slack. Thank you, Madam Chair.
Thank you, Madam Administrator. Moving on to page 2 on our agenda. Item 7, Senate Bill number 1229. This is an act concerning emergency medical services. This is a JF to the floor. May I have a motion?
So move.
Moved by Senator Anwar. Is there a second? Seconded by Representative Clara Distria. Senator Anwar.
Thank you so much, Madam Co-Chair. This is an act concerning emergency medical services. As I had suggested in an earlier conversation that we are having a challenge with the EMS services in our state. The challenges are multifold, and some of the other bills in other committees are addressing them because they had cognizance with other committees, but this is part of our committee, this part. We are looking at opportunities to collect the data for our emergency medical services for the calls, the response times in some respects, and also having a better understanding of the type of calls and the reasons for the calls. And sometimes there's mutual aid being requested. So we are hoping to get the data to start to look at the development of EMS deserts in our state. If I was to listen to various EMS providers, they would tell us that these are rural parts of our state where there are a lot of mutual aids being asked. So we are asking for the data to come together and also looking at the EMS advisory board, opening up the board for having a representation from EMTs and paramedics in it as well, and also looking at the trends that we are seeing in the emergency medical services and the type of pattern that we have. And also recognizing the fact that we don't have enough EMTs and paramedics in our state, we want to start to look at how can we address the workforce part. The part about the workforce in this bill is in the form of Advisory Board, we are still looking at the possibility of going a little bit deeper into what can be placed into the entire bill. We had to limit that because of the JF deadline. But that may change in this bill, Madam Chair, but this is an important bill and we hope that we can move forward with this.
Thank you very much, Senator Anwar. Discussion on this item. Representative Kennedy.
Thank you. I just have a question for clarification. When you say emergency medical services and you said specific parts of the states, are you referring also to career fire departments that they'll be responding and completing these reports that are being requested? For you,
That's
Madam Chair?
not in this bill at this
Not
point.
this, okay. I just wanted to be clear. Thank you.
Thank you.
Thank you, Madam Chair.
Thank you, Representative Kennedy. Seeing no other discussion, Representative Claritas Tetria.
Thank you, Madam Chair. I'd like to start a consent calendar. Make a motion to start a consent calendar.
Wonderful. Rep. Claritas Tetria has made a
Second.
motion and Senator Anwar has seconded the beginning of a consent calendar. We'll have a voice vote on the, actually, you know what? We don't need to have a voice vote, do we? No. Yes. Sometimes you forget these things. Okay, so we have that. And Representative Claritas Tetria, is there something you'd like to add?
Yes, thank you, Madam Chair. I'd like to put this item on the consent calendar.
Wonderful. Seeing and hearing no objection, we have now established a consent calendar that's been moved and seconded. We have one item on the consent calendar. That's item number 7, Senate Bill 1229. So moving on to item number 8, that's House Bill number 6602. This is an act concerning funeral directors and funeral homes. This is a JFS to the floor, LCO 6382. May I have a motion? So moved.
Second.
Moved by Senator Kushner and seconded by Senator Anwar. This bill, as I said momentarily, or just a moment ago, this bill is S language. So it does retain the language that would give all state licensed funeral directors who operate out of state funeral businesses access to the electronic death registry system. And it requires DPH to annually inspect the buildings where their funeral services are being conducted. The current law requires inspections every 3 years. And finally, the bill, the S language changes to a study that DPH will conduct whether to exempt funeral directors from the requirements to employ a full-time licensed embalmer if they become owners in full or part of a funeral home. And that report will come back to the Public Health Committee by February 1st, 2024. Is there discussion on this item? Oh, Representative Dauphiné.
Thank you, Madam Chair. My question is, does the DPH have staff to do these inspections?
Thank you very much, Representative Dauphiné. I haven't had a direct conversation with them regarding the staffing, but I think this is something that we will likely, as with most of our other bills that involve DPH, be having ongoing conversations. We have a long list for you, DPH. Are there other questions, other discussion? Seeing and hearing none, Madam Administrator, would you kindly call the roll?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy Vehy,
Representative McCarthy Vehy votes yes.
Senator Kushner,
Senator Kushner votes yes.
Senator Mark,
Senator Marks votes yes.
Senator Summers, Representative Claritas Tetria,
Representative Claritas Tetria votes yes.
Representative Belton,
Representative Belton votes yes.
Representative Burgess Javallo,
Rep. Burger Javallo votes yes.
Senator Cabrera, Representative Carpino, Representative Cook,
Representative Cook votes yes.
Representative Dauphiné,
Rep. Dauphiné votes yes.
Representative DiCaprio,
Representative DiCaprio votes yes.
Representative D'Amico,
D'Amico votes yes.
Representative Denning,
Representative Denning votes yes.
Representative Elliott, Representative Foster,
Rep. Foster votes yes.
Representative Jengo,
Representative Jenga votes yes.
Senator Gordon,
Senator Gordon votes yes.
Representative Cavers DeGraw.
Cavers DeGraw votes yes.
I did not see you on screen, please.
Cavers votes yes.
Thank you. Representative Kidd,
Representative Kit votes yes.
Representative Kennedy,
Kennedy votes yes.
Representative Lenahan,
Linehan votes yes.
Representative Morrow,
Representative Mara votes yes.
Representative McCarthy,
Representative McCarty votes yes.
Representative Palm,
Palm votes yes.
Representative Perillo,
Perillo votes yes.
Representative Rader,
Representative Rader votes yes.
Senator Rahman, Representative Reddington Hughes,
Reddington Hughes votes yes.
Representative Ryan,
Representative Ryan votes yes.
Senator Slack, Representative Steinberg,
Representative Steinberg votes yes.
Representative Welander,
Representative Welander votes yes.
Representative Zupkis,
Representative Zupkus votes yes.
Senator Cabrera, Representative Carpino, Representative Elliott, Senator Slack, Senator Rahman. Thank you, Madam Chair.
Thank you very much, Madam Administrator. Moving on to item number 9, this is House Bill number 6733, an act concerning the Department of Public Health's recommendations regarding various revisions to the public health statutes. This is a JF to the floor. May I have a motion?
So move.
Moved by Senator Anwar. Is there a second? Second by Representative Steinberg. And this bill, I'm going to take a few moments to outline. We've got about 29 sections, so bear with me. I'm going to just go through so that we all know what it is that we will be voting on today. So first, this modifies the statutory definition of assisted living service agency. Let me preface this entire statement by saying this bill is a JF. It has a lot of sections with a lot of different pieces to it. And we absolutely know and recognize that this is a work in progress. So there are multiple sections that will be requiring revision and ongoing conversation. So I'll say that before I go any farther. So specifically, this change would allow those assisted living service agencies to provide end-of-life services. And we know we have some discussion to have on that one to start. Same as with the second and third section, which is around the social work licensure, which we have a separate bill for that we've already passed out of this committee. The Department of Public Health does eliminate the examination and allows the in-person continuing ed to be done through live online courses. So we clearly have discussion to have in that section. Next, we are addressing the issue of estheticians and nail technicians and the grandfathering. I know Rep. Claritas Detria is someone who's been advocating to address that, which is something that is fixing that which we passed previously, or which all of you in this committee had passed previously. We also have a section related to vehicle design and equipment standards in EMS that are some changes in regulation. Again, we've heard from some folks in EMS about this and DPH, and we will be having ongoing conversation with them related to that. This is the bill that does have the language that creates a new licensure category for the blood plasma donation centers and blood collection facilities. And so we can talk a little bit more about that going forward. So beginning October 1st, 2023, these centers would need to be licensed, and it establishes those requirements. The compacts for psychologists and physicians that were passed need some fixes related to the national background check and fingerprinting, and this language does that for us, although it appears we may need to even do a little bit more with that, if I'm remembering that category correctly. The bill also eliminates the requirements that municipal public health directors who are licensed physicians also have a public health degree. The bill will make a technical change to the income tax credit for the birth of a stillborn child. The bill also changes the requirements for primary care providers in terms of hepatitis C screenings. So that screening or test would be for patients 18 and older and pregnant women rather than just those born in a 20-year time period from 1945 to 65. This bill will also allow the commissioner to have a little more say and to revise as she sees necessary the quality of care program standardized data sets for healthcare facilities. It also adds the education commissioner or her designee to the membership of the Commission on Community Gun Violence Intervention and Prevention. And I can hear Rep. McCarty's voice in my head right now as I say that. It requires the Commissioner of Public Health to prescribe electronic reporting requirements and develop data collection in terms of asbestos abatement, and also to implement policies and procedures on the licensure and certification standards, both for less asbestos and lead abatement professionals. It specifies that DPH has jurisdiction over all public water supply sources, including those held for future or emergency use. This is another area that will be for ongoing discussion that we've heard from folks on different sides of this issue. This also will automatically rescind the automatic reciprocal discipline against a health professional or pharmacist licensed in another state or jurisdiction if the discipline was based solely on terminating a pregnancy under conditions that wouldn't violate state law. It gives another year to our local health departments in creating the electronic reporting system for the reporting of sodium chloride damage. And it exempts eyebrow threading from the statutory definition of aesthetics, so that those who are doing eyebrow threading do not need to have an esthetician license. And I'm almost there. Thank you for your patience, everyone. It also establishes a statutory definition of fetal death for purposes of a fetal death certificate. It authorizes certified ambulance services to provide non-emergency patient transport. This will be in addition to those licensed ambulance providers who are already doing so. Again, I will note this is an ongoing conversation. And finally, it makes some changes to the requirements for the chief medical examiner. So there's a lot to this bill and I welcome discussion. Representative Claritas Tetria.
Thank you, Madam Chair. So going back to the blood plasma section, excuse me. Why does it remove, my first question, why does it remove the waiver process?
So because the goal is to create an actual licensure process as opposed to having waivers. So the language, and I will say, as I think I can keep saying, I may be on repeat. We are going to be remaining in conversation with DPH. We heard from them that, you know, even October feels a little bit perhaps pressed, but I think we've heard from others that there's a goal to try and get these centers open as quickly as possible. So some folks were advocating waivers. What we've done is retained, as you know, since this is a JFS, the language in this bill. We do have a separate bill that will have that similar language, but to stick with a licensure process as opposed to a waiver process.
Okay, and I understand that it is a work in progress and hopefully we can get this going before, even before October 1st, because I know some of these organizations are anxious to get up and running. So hopefully we can continue to work through that and possibly get it done before October 1st. And then my only other question is on the threading, can you explain to me why we're not going to license them?
The simple answer to that is no. I cannot. I think that's a question that I would have to ask DPH, and so I can't give you a good answer for that. I'm gonna have to get back to you.
Okay, just for also clarification, in the regulation, I think it says having to do with eyebrows as part of the licensure scheme. So like I said, at some point, hopefully I can get a clarification as to why. Thank you, Madam Chair.
Thank you. And I'm sorry, I don't have that answer for you today. I also, Rep. Claritas Teacher, I want to thank you for your comments around the blood plasma collection. I think many of us share that sentiment that we would like to see this move as quickly as possible. And again, we are going to be continuing the conversation with DPH. There are a lot of folks who we've heard from, not just folks who have testified, but here within our various caucuses who are interested in that as well. So I thank you for those comments. Senator Anwar.
Thank you, Madam Co-Chair. Madam Co-Chair, if I have this correctly, I think we will need more discussions on item 2, 4, 5, 8, 15, and 20.
I think
And 20. Eyebrows, yeah. Sorry, and eyebrows too. I mean, not raising my eyebrows is saying that the part about the eyebrows.
I thank you, Senator Anwar. You're again underscoring that there will be probably quite a few hours that we will be spending with our good supportive staff and leaders at the Department of Public Health. As I look at you out there, certainly a lot of conversation and a lot of work to do. Representative Jenga, do you have?
Thank you, Madam Chair. I believe I heard you say on the section I'm concerned about, section 20, that there'd be further discussion. Water companies have concerns about that section because Department of Public Health is now asking for jurisdiction over some matters that they don't have jurisdiction. And I believe that should be thoroughly discussed.
Thank you very much, Representative Jenga. Yes, section 20 of the bill does specify that, and you are absolutely right. We have heard from folks and we understand that there is a concern that we're going to need to bring parties together and address that issue. We have been very fortunate in the state of Connecticut when it comes to water. Some of our counterparts on the West Coast have had very difficult battles when it comes to discussing water, and it's something that we want to be mindful of going forward. And we hope that that's not something that will be the same kind of conversation here, but in all likelihood, in the decades to come, it will. So we want to be very careful with how we are addressing that issue. So I appreciate your comments, Representative Jenga. Is there other discussion? Seeing and hearing none. Madam Administrator, would you kindly call the roll?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy Vehy,
Representative McCarthy Vehy votes yes.
Senator Kushner,
Senator Kushner votes yes.
Senator Marks,
Senator Marks votes yes.
Senator Summers, Representative Claritas Dutria,
Representative Claritas Dutria votes yes.
Representative Belton,
Representative Belton votes yes.
Representative Berger Givallo,
Rep. Berger Givallo votes yes.
Senator Cabrera, Representative Carpino, Representative Cook,
Cook votes yes.
Representative Dauphiné,
Rep. Dauphiné votes no.
And 20.
Representative DiCaprio,
Representative DiCaprio votes no.
Representative D'Amico,
D'Amico votes yes.
Representative Denning,
Representative Denning votes yes.
Representative Elliott, Representative Foster,
Rep. Foster votes yes.
Representative Django,
Rep. Jenga votes yes.
Senator Gordon,
Senator Gordon votes yes.
Representative Cabras DeGraw.
Cabros DeGraw votes yes.
I did not see you on screen, please.
Cabros DeGraw votes yes.
Thank you. Representative Kidd.
Representative Kit votes yes.
Representative Kennedy.
Kennedy votes yes today, reserving the right to change my vote on the floor once we have all the moving parts of this very lengthy bill with the questions answered. Thank you.
Representative Linehan.
Linehan votes yes.
Representative Mara.
Representative Mara votes yes.
Representative McCarthy.
Representative McCarty votes yes.
Representative Palm.
Palm votes yes.
Representative Perillo.
Perillo votes yes.
Representative Rader.
Representative Rader votes yes.
Senator Rahman. Representative Reddington Hughes.
Representative Reddington Hughes votes no.
Representative Ryan.
Representative Ryan votes yes.
Senator Slack.
Senator Slack votes yes.
And Representative Steinberg.
Representative Steinberg votes yes.
Representative Welander.
Representative Welander votes yes.
Representative Zupkis.
Representative Zupkis votes no.
Senator Summers. Senator Cabrera. Representative Carpino. Representative Elliott. Senator Rahman. Thank you, Madam Chair.
Thank you very much, Madam Administrator. Moving on to item number 10, House Bill 6740. This is an act concerning hospital financial policies. This is a JFS to the floor. LCO 6384. May I have a motion?
So move.
Moved by Senator Amor. Is there a second? Seconded by Representative Belton. This bill makes some slight changes to the original bill. Will also be a conversation. We know that, as Senator Amor said, certainly our hospitals have been facing a lot in post-COVID world. And we also know that our patients and our families have been facing a lot as well, particularly those who are working to address paying for the hospital charges. So this bill would essentially address the issue of financial assistance for those who are, regardless of immigration status, enrolled in SNAP or WIC, and it would also prohibit hospitals from requiring patients before receiving assistance to apply for Medicaid, Medicare, or other funding. It would ask that hospitals provide a uniform application process and form to patients if the hospital believes that the patient may lack funds for services. And it does allow the Attorney General to investigate alleged violations. It adds information that the hospitals must annually report to the Office of Healthcare Strategy. And it generally prohibits hospitals from referring patients to collection agents or bringing court action to collect unpaid bills unless the hospital determined the patient is uninsured and not eligible for financial assistance. And also requires that hospitals provide a plain language summary describing that financial assistance policy. And it takes a few other steps, again, all addressing the issue of trying to be sure that folks are not going into medical debt that becomes debilitating. Again, this bill will remain a work in progress and conversation. We are grateful for the proponents, and I'm going to open it for discussion. Representative Claridis Tetria.
Thank you, Madam Chair. for clarification, in this bill, if the hospital is discussing their bill and payments with the patient, they can't, if the hospital feels that this patient could qualify for the exchange, they can't have a conversation with them at all per this bill.
So I think it's more that they cannot require the patients to apply for some of these other insurances, whether it's Medicaid, Medicare, or insurance through Access Health, unless there's a reasonable belief that they can qualify.
Okay, thank you for that clarification. And the second part, if the hospital sends a patient's bill to the collection agency, is the patient allowed at that point to still apply for financial assistance or any of the programs?
So I think the bill is generally, the goal is to not have those bills go to collections agencies. And I think the proponents from Health Equity Solutions and others are seeking to avoid going into that collections place altogether.
Thank you, Madam Chair.
Senator Anwar.
Thank you, Madam Co-Chair. I think the prism with which we should look at this bill is the fact that one of the commonest cause in Connecticut for bankruptcy is because of medical bankruptcy. And if somebody has had an urgent procedure, they're underinsured or do not have insurance, they would have to declare bankruptcy. There are areas of prevention of that because prevention is far better even on the financial side. And there are efforts to try and come to this conclusion. The way the hospital system see this is that there's a cost to the hospitals to be able to do this. It's important to start to look at ways we can start to tighten up system where we can have enough information to the individuals who would be at a high risk. And also some of the healthcare systems, and every healthcare system is different, where they may expedite the bankruptcy in some situations. So we want to try and have prevention strategies around that as well. So this will require a much more in-depth conversation. This is a pretty extensive list, and we will be looking at ways to get everybody on the same page and get the hospital association on the same page as well to try and find the ones that they would be accepting. So we will have a lot of conversation on this bill going forward. This is not the final version that we will see on the floor. Thank you, Madam Co-Chair.
Thank you, Senator Anwar, for saying that much more articulately, I think, than I was able to. I will go next to Representative Kennedy, or excuse me, Representative Kennedy, to be followed by Senator Gordon.
Thank you, Madam Chair. I have concerns with this bill. The bill seems to imply that someone wouldn't necessarily get treatment if they went to the hospital. So I have concerns with that. I'm also concerned about the hospital's ability to seek reinsurance. It seems like provisions we're undermining the current provisions that are in place. As you stated, there's a lot of work to be done on this bill right now. As it's written, I just will not be able to support it today. I think that we can do better, and we can work with the Hospital Association, as you stated, and to move better, move along with this bill. But today I cannot support this bill as it's written. Thank you, Madam Chair.
Thank you, Representative. Senator Gordon.
Thank you very much, Madam Chair. I do share some concerns with regards to what actual more work on this bill is to be looked into. I'm assuming if more work on this bill is going to be looked into, wording will change or whatever manner, but is there any listing of what exactly more specifics is going to be looked into and details of that, just so we would know if we're going to be voting on this bill today? Thank you, Madam Chair.
I think what happens as we JF bills is often the case, and as such in this one, is that we have proponents and we have folks from the Hospital Association, and we really want to talk together. We want to hear more from each of them about what we think could work. Really, the ultimate goal is to assure, as Senator Anwar, I think, put very well, that patients are not leaving the hospital after being cared for with the kind of debt that is going to cause bankruptcy, and to be putting all the systems into place that we can. So as we work to refine those systems, we need to hear more from both parties about which pieces of this will be the most practical and viable going forward and the most impactful. So I wish I had a more specific answer to you, but I think it truly will require more conversation.
No, I appreciate that, Madam Chair, and because it sounds like there's quite a bit of stuff to be looked into. If I were to vote no on it, it's not because I'm opposed to the general intent. It's just certainly would want to see where exactly things are going to fall out in process. Thank you.
Thank you, Senator. Senator Amor.
Thank you so much, Madam Co-Chair. I just wanted to mention that this bill is going to be less than what we are seeing right now. So we have a number of issues that are on the table, and we are going to be able to remove some of those as we move forward. So that's what the conversation will be. Thank you.
Thank you, Senator Amor. Is there further discussion on the item? Seeing and hearing none, Madam Administrator, would you kindly call the roll?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy Vahey,
Representative McCarthy Vahey votes yes.
Senator Kushner,
Senator Kushner votes yes.
Senator Mark, Senator Summers, Representative Clarice Detrier,
Representative Clarice Duce votes no.
Representative Belton,
Representative Belton votes yes.
Representative Burger Givallo,
Rep. Burger Givallo votes yes.
Senator Cabrera, Representative Carpino, Representative Cook,
Representative Cook votes yes.
Representative Dauphiné,
Rep. Dauphiné votes no.
Representative DiCaprio,
Representative DiCaprio votes no.
Representative D'Amico,
D'Amico votes yes.
Representative Denning,
Representative Denning votes yes.
Representative Elliott, Representative Foster, Representative Jango, Representative Gilchrist, Senator Gordon,
Senator Gordon votes no.
Representative Cabros DeGraw.
Stavros DeGraw votes yes.
Thank you. Representative Kidd,
Representative Kidd votes yes.
Representative Kennedy,
Kennedy votes no.
Representative Linehan.
Linehan votes yes.
I did not see you on screen, please.
Representative Linehan votes yes.
Thank you. Representative Mara,
Representative Mara votes no.
Representative McCarthy,
Representative McCarty votes no.
Representative Palm,
Palm votes yes.
Representative Perillo,
Perillo votes no.
Representative Rader,
Representative Rader votes yes.
Senator Rahman, Representative Reddington Hughes,
Representative Reddington Hughes votes no.
Representative Ryan,
Representative Ryan votes yes.
Senator Slack,
Senator Slack votes yes.
Representative Steinberg,
Representative Steinberg votes yes.
Representative Wielander,
Representative Wielander votes yes.
Representative Zupkis,
Representative Zupkis votes no.
Senator Marks, Senator Cabrera, Representative Carpino, Representative Elliott, Representative Foster, Representative Jango, Senator Rahman. Thank you, Madam Chair.
Thank you, Madam Administrator. All right, we're making progress, everyone. We're moving on to item number 11. This is House Bill number 6835. This is an act concerning various revisions to the public health statutes. This is a JF to the floor. May I have a motion?
So move.
Moved by Senator Anwar. Is there a second? Seconded by Senator Kushner. This one is similar to the Department of Public Health bill, but much more compact. And it's a JF. So again, suspect that we will be working on this one as we go through. There are a few changes that the bill makes, though it has a lot of sections. There are only a handful of changes. One of them is that our surgical technologists, they must go through a nationally accredited program or hold a certification in order to serve in outpatient surgical facilities and hospitals, certain hospitals. So massage therapists now, instead of doing 6 of their continuing ed credits via the internet or with distance learning, will be able to complete 18 in that way. The psychologists, prior to the licensure renewal, will be able to submit to DPH a retirement application and a one-time fee of $50. And this will allow DPH to recognize the psychologists as being retired in good standing. We want to make sure that we have that language correct, and we are going to be working directly with the psychologists to assure that we do. And then finally, the majority of the bill, the majority of the language would authorize tribal lands to issue birth and death certificates. And then it makes those related changes. So that's what the bulk of the language is in the bill. Is there discussion on the item? Senator Gordon.
Yes, thank you, Madam Chair. I want to speak to section 3, where it talks about psychologists having to notify the state of being retired or planning to retire. Certainly good for a psychologist if a psychologist is ready to retire. I do not understand why the state would charge them $50. I can't imagine what DPH would do to even earn $50. If a psychologist has been practicing in this state and wishes to retire, I think DPH should say thank you and not charge him $50 and just process the retirement application. So I would hope that we could do something about that. Just make any sense, $50 to, are there any other professions that when they retire, they get charged a fee to retire via DPH? I don't think doctors or nurses or others do. So I just don't see why we would charge $50, but thank you, Madam Chair.
Thank you, Senator Gordon. You may recall in my opening remarks that we wanted to make sure that we had that language correct. We had worked with a psychologist, so I'm not answering your question, not that I'm aware of, in terms of other categories of licensure. I think the intent may have been that if there was a retired psychologist who wanted to be active again and practice, and that may have been the case, we want to make sure that we get that language right and are working really at the direction of the psychologist. So I think this was not an effort on our part to somehow collect fees at a time when we are desperately needing more providers. So I think we will be continuing to work on this language in this bill.
Thank you. I appreciate that.
Thank you. Are there other points of discussion, comments, questions? Did I see a hand? Representative McCarty.
Thank you very much, Madam Chair. Just going through the bill again, and I will be supportive, but looking at the surgical technologists and looking at what the Hospital Association, will there be an ongoing effort to work with the hospitals on defining that role and what's going to be expected?
The short answer is yes, Rep. McCarty, and I think you've heard, I was with the students, as I mentioned earlier, and I did say to them, homework doesn't end. So Senator Anwar and I will be spending a fair bit of time, not just with the Department of Public Health, but with the Hospital Association and others to work on language on this and other bills as well.
Thank you so much.
Thank you. Representative Kennedy.
Thank you, Madam Chair. I'm just looking at testimony again. in this bill, the one concern I have with this bill is the requirement of the licensed psychologist. And I have a better understanding from reading the testimony, but I would like to see that language worked on, because I do appreciate the changes that have made for the massage therapists from 6 to 18. So that's a positive. I will be voting yes today, but I hope that we'll continue to work on the language regarding the psychologists. Thank you very much, Madam Chair.
Thank you. And I would note both with this and as I said, with the workforce bill, I think that we're hearing from a number of different groups who are seeking to provide support to the people of the state. And so I know that Senator Anwar and I are committed to continuing those conversations. We heard testimony, for example, on Wednesday from the licensed professional counselors who are interested in us. And you probably are getting emails as public health committee members passing a compact. So we are going to continue to do this work to make sure that we are, again, providing as many available options for us to address the health and mental health concerns that, as we have said before, we're trending in the wrong direction prior to the pandemic and have been exacerbated. So I appreciate those comments. Seeing no further discussion, Madam Administrator, would you kindly call the roll?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy Vahey,
Representative McCarthy Vahey votes yes.
Senator Kushner,
Senator Kushner votes yes.
Senator Mark, Representative Tiredis Tetria,
Representative Claris Tetria votes no to flag.
just a moment, please, Madam Chair. Thank you. Representative Belton,
Representative Belton votes yes.
Representative Berger Givallo,
Rep. Berger Givallo votes yes.
Senator Cabrera, Representative Cook,
Representative Cook votes yes.
Representative Dauphiné,
Rep. Dauphiné votes no.
Representative DiCaprio,
Representative DiCaprio votes yes.
Representative D'Amico,
D'Amico votes yes.
Representative Denning,
Representative Denning votes yes.
Representative Elliott, Representative Foster, Representative Jenga, Senator Gordon,
Senator Gordon votes yes.
Representative Cavros DeGraw,
Cavros DeGraw votes yes.
Representative Kitt,
Representative Kitt votes yes.
Representative Kennedy,
Representative Kennedy
Lanahan,
votes yes.
Representative Kennedy,
My apologies, Madam Administrator. Kennedy votes yes, knowing this bill.
Representative
will be
Lanahan,
worked on.
Representative Linehan votes yes.
Representative Mara,
Representative Mara votes yes.
Representative McCarthy,
Representative McCarty votes yes.
Representative Palm,
Palm votes yes.
Representative Perello, Representative Rader,
Representative Rader votes yes.
Senator Rahman, Representative Reddington Hughes,
Reddington Hughes votes no.
Representative Ryan,
Representative Ryan votes yes.
Senator Slapp,
Senator Slapp votes yes.
Representative Steinberg,
Representative Steinberg votes yes.
Representative Welander,
Representative Welander votes yes.
Representative Zupkis,
Representative Zupkis votes no and hopes that we'll fix that payment for the psychology. Thank you.
Senator Mark, Senator Cabrera, Representative Carpino, Representative Elliott, Representative Foster, Representative Jenga,
Representative Jenga votes yes.
thank you, Madam Chair.
Thank you, Madam Administrator. Moving on to item 12 on the agenda, House Bill number 6836. This is an act concerning blood plasma collection. This is a JFS to the floor, LCO 6381. May I have a motion? Moved
Second.
by Representative Cook, seconded by Senator Anwar. As discussed in the earlier discussion on the revisions bill, this JFS language will actually parallel that, which it will then create a new licensure category. And starting October 1st, 2023, same date, that will require that process to go into place. And it puts various related requirements into place. Is there discussion on this item? Representative D'Amico.
Thank you very much, Madam Chair. Madam Chair, I had initially two concerns about this bill. The first one has been satisfied with the substitute language. The Commissioner of the Department of Public Health was concerned about the waiver process. So am I correct that the substitute language eliminates the waiver possibility?
The substitute language makes a new licensure category. It does not do the waiver process. Creates a new licensure. The simple way of me answering is yes.
Okay, thank you. I appreciate that. And that's what I gathered from looking at the language. But the other concern that I had, I don't believe has been addressed in the substitute language. And it was raised by a nurse who testified. And I'm just going to briefly read an excerpt or two from her testimony. She said that currently public health regulations require that the infusion of these and any solutions referring to the apheresis process be performed only by licensed personnel, i.e. RNs or LPNs. Then she goes further to say, if this bill were to pass as it is written, Commission of DPH could potentially eliminate both the requirement for an MD as well as the requirement for licensed RNs or LPNs in one fell swoop. This bill eliminates important protections of the public. It's important that DPH oversight remains strong and not be diminished. So when I read something like that, I get a little nervous. So I'd like to know if that has been addressed in the substitute language, and if not, if we are planning to address it somewhere down the road.
Thank you, Representative D'Amico. No, not specifically. This language is language that the Department of Public Health had put into their own bill. There are also federal requirements and regulations that those who have been proponents of the bill have worked on. There are blood plasma collection centers in many other states at this point. We are looking to parallel that process in many ways. I think that public health and safety, obviously, for our Department of Public Health is forefront. I think that the concern about safety is something that we certainly can continue to talk about. And to answer your question directly, no, we are not having specific conversations related to that testimony or that specific issue.
Well, I appreciate that, Madam Chair, but I have to say it's still a concern for me. And I suspect that I'm not the only one for whom this is a concern, but I will leave it at that. Thank you.
I appreciate you raising that and sharing that with the committee. Senator Anwar.
Thank you so much for bringing that up, Representative D'Amico. I think it's important because some of these procedures may cause an episode of hypotension or a vasovagal reaction. A person may pass out. So you need a healthcare person in the facility. From our conversations with everybody who was applying, we did not hear from anyone that they did not want, they just did not want a physician there because they felt the cost was an issue, and that was what the waiver was about. It was not about nursing staff or others. So that's how we in our conversation looked at that.
And I appreciate that. If I may,
please,
Mr. Chair. So I appreciate that. But again, I think the concern is, as was expressed in the testimony, that the commissioner could eliminate the requirement both for a physician to be present as well as the requirement for a nurse to be present. And one might be okay, but I'm not sure that eliminating the requirement for the other is a good idea. And if someone can convince me otherwise, I would be very happy. Thank you.
I don't think we'll convince you because I'm not convinced myself. Because and you're right. So it's a fair question, and then the fact that we're having this conversation and on the record would help us be on the record to say that that cannot be removed, and we'll have to work with DPH to make sure that some of these corporations, they're very much interested to be in this market, and they are planning to come to stay here. But we will make sure that their protections for the patients are going to be in the picture. So. Thank
Thank you,
you.
Senator Almar. Any other discussion on this item? I appreciate the conversation, as always, important and helpful input. Seeing none. Madam Administrator, would you kindly call the roll?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy Vahey,
Representative McCarthy Vahey votes yes.
Senator Kushner,
Senator Kushner votes yes.
Senator Mark, Representative Clarice Detrier,
Representative Claire DeStitria votes no to flag that one question. Thank you.
Representative Belton,
Representative Belton votes yes.
Representative Burger Givallo,
Rep. Burger Givallo votes yes.
Senator Cabrera, Representative Carpino, Representative Cook,
Cook votes yes.
Representative Dauphiné,
Rep. Dauphiné votes no.
Rep. Dauphiné, I did not see you on screen, please.
Rep. Dauphiné votes no.
Thank you. Representative DiCaprio,
Representative DiCaprio votes no.
Representative D'Amico,
D'Amico votes no.
Representative Denning,
Representative Denning votes yes.
Representative Elliott, Representative Foster, Representative Jengo,
Representative Jenga votes yes.
Senator Gordon,
Senator Gordon votes no due to the safety concerns.
Representative Cabras DeGraw,
Tavros DeGraw votes yes.
Representative Kitt,
Representative Kitt votes yes.
Representative Kitt, I did not see you on screen, please.
Representative Kitt votes yes.
I'll come back to you. I didn't see you. Representative Kennedy,
Kennedy votes no due to the concerns raised.
Representative Linehan,
Linehan votes yes.
Representative Morrow,
Representative Mara votes no.
Representative McCarthy,
Representative McCarty votes no.
Representative Palm,
Palm votes no.
Representative Perello, Representative Rader,
Representative Rader votes yes.
Senator Rahman, Representative Reddington Hughes,
Representative Reddington Hughes votes no.
Representative Ryan,
Representative Ryan votes yes.
Senator Slack,
Senator Slav votes yes.
Representative Steinberg,
Representative Steinberg votes yes.
Representative Wheelander,
Representative Wheelander votes yes.
Representative Zupkis,
Representative Zupkis votes no.
Senator Marks, Senator Summers, Representative Cabrera, Representative Carpino, Representative Elliott, Representative Foster, Representative Kitt,
Representative Kitt votes yes. Can you see me this
no
time?
ma'am.
Okay, I will have to log out and log back in to register my vote.
Okay, thank you. Representative Perello, Senator Rahman. Thank you, Madam Chair.
Thank you, Madam Administrator. Moving on to item number 13, House Bill number 6894, an act concerning certificates of need. This is a JF to the floor. May I have a motion?
So move.
Moved by Senator Amor. Is there a second? Seconded by Representative McCarty. Senator Amor.
Thank you, Madam Co-Chair. Madam Co-Chair, it's a pretty straightforward bill, which is basically asking the Executive Director of the Office of Health Strategies to evaluate the CON application process and identify the portions of such process which can be streamlined or expedited. The background is if somebody has a facility who has a MRI machine and you have a new version of that available, rather than going through the extensive process that can be pretty straightforward to streamlined. And my understanding is we don't have that process, and we feel that it's important to look at this and get a response back before January 1st of 2024. We do have a number of people who have requested a lot of other things on CON. We feel that the next year we're going to be looking at the CON in much more in-depth analysis, but this is just a starting point to look at the easiest part of it. Thank you.
Thank you, Senator. Representative Cook to be followed by Representative Steinberg.
Thank you, Madam Chairman, and I want to thank the senator for his synopsis of the legislation. I would have to say that I am disappointed. I know that there were some extremely important, questionable, whether they fell under the CON or did not fall under CON, and that's vitally important right now. We talk about healthcare shortages and we talk about nurses, and the good senator is very well aware of how I feel about this. And APRNs, and I would really hope that we would not wait. As the good senator had told me a month or so ago that we would be drafting a letter asking the department to really weigh into these things. I don't want to wait on that. I would like our letter to go out. I think that if there are decisions that they can make with outside of the legislative process, I think that's extremely helpful, not only to ourselves, because we tend to get a little wonky, but to the system as a whole. And if we can see that APRNs and RNs, and you fill in the blank, can fill in the gaps of the shortages of our healthcare systems, I think that's extremely important, and we need to entrust that they can do that. And I would appreciate that if we could go forward with the letter to the department, not wait until next legislative session, and truly ask them to weigh in as soon as possible, because at the end of the day, some of these things we might not need to legislatively change, but that could actually save lives between now and then. So I would hope for our consideration. Thank you, Mr.
Thank you, Representative Cook. I think Representative Cook, you are referring to the scope issue, and we're talking about the CON. You're talking about both? Okay. I can answer the CON process because that goes through a different department. The CON is with the Office of Health Strategies, and in one of the previous meetings, we had a discussion with and in public as well. I think our executive director for Office of Health Strategies, she's just taken on the new position, a new responsibility, and she's very clear that she is looking at the entire department and looking at the processes within the entire department. So we had an open conversation. I'm repeating the conversation again, and there clearly are areas of opportunity in CON, and everybody understands that. She recognizes it very well. And she felt that a lot of those things that she is reviewing right now, she'll be able to address them directly herself without a bill. And that's precisely why we did not put a whole bill, besides the fact that we have run out of bandwidth. As you can see how many bills and how much paper we are looking at. We had about 6-7 items on a CON itself. And we discussed all of them with her and her team, and they feel that they want to be able to look at the ground reality of what's going on, and they will work with us. And then we will have to have a bill if we need laws to be changed, but the internal dynamics and the functioning needs to be addressed as well, especially because you cannot have the hospitals just leave a community and then leave women's health behind, which is what has happened. And at the same time, when somebody wants to go in, they have to wait for 8 months to get into the same place. So, and then if you can notice that the birthing center bill, they have removed the CON. So there are internal things that are happening that are really somewhat encouraging. And that's why we felt that there is an opportunity to get some of those things fixed, but there will have to be a bill next year too.
And I thank you for that. And then my follow-up to that is, given the situation that we're in and the path that has been chosen to be taken, will we get notification between this legislative session and next legislative session as to the updates of what those the statuses of those CONs are, and then what we might need to do? Or are we just assuming that we might find out, or we're just going to wait till next year?
Well, we are hoping that we will get some report from our executive director of Office of Health Strategies. As we do, we will ask that it be shared with the entire Public Health Committee, because that's the cognizance with that committee. There was a working group that has given pretty extensive presentation in the beginning of this session. They are looking at as a base for starting to look at the policy changes that they're going to make internally. So that's the starting point from those reports. But as soon as we have a written report and a detailed plan from them, we will look at that for sure.
And have we put an expectation into when we're looking for that report to come to us, or is that ball in their court?
It is in their court right now.
I'd like to see some time on that. But I will move this to hope that we can continue to work it out. Thank you.
Thank you.
Thank you. Just to specifically with Representative Cook, with respect to this bill, it does require a January 1st, 2024 report. I would also add, just to what Senator Anwar said, that the Office of Health Strategy has initiated regular ongoing updates and communications with the leadership of various committees. And I think what I hear you saying is that you'd perhaps like us to at some point broaden that conversation so that the whole committee can be appraised of what's happening. Representative Steinberg.
Thank you, Madam Chair. I think it's difficult to simply dip one's toe into the issue of CON. It is actually not a really particularly useful descriptor, given the very many different types of processes it represents. And I think that's perhaps part of the fundamental problem we have. I know the Insurance Committee looked at CON in the past couple of years, but this committee hasn't really focused as much on it ever since the Healthcare Cabinet took a look at it. Along with Representative Cook's point, I'm not sure I'm prepared to wait a year to find out more. Personally, I have great faith in Deidre Gifford. It was an important shift of somebody with her background to take on this role at the Office of Healthcare Strategy. I think that's an indication that it matters to this administration. I'm also hopeful that the additional bodies that we've been able to get over there is having an impact on turnaround time for CONs. So I would love to get an update, and to Representative Cook's point, maybe we don't wait for them to get back to us. Perhaps off session when there's no pressure on us. Perhaps the chairs would contemplate an informational forum, which would serve not only the purpose of getting a report from the office, but also to level set for the benefit of everybody on this committee. So there's a greater general understanding of what CON is and isn't, and what our options are. Thank you, Mr. Chair.
Thank you. I agree with you. Yes, Representative Kennedy.
Thank you, Mr. Chairman. And thank you to my colleagues for their comments on the CON is a little complicated, but the changes to the CON process are so sorely needed. Our hospitals continue to meet the challenges caused by the COVID-19 pandemic, and each and every day they face new challenges. So our legislative commitment should be focused on reducing regulatory burdens on our hospital system, improving the process, and removing unnecessary costs to our hospitals. I will be voting yes today. I look forward to that report, and believe it or not, that's just merely 9 months away, but I will be a yes with the assurances that the process will be streamlined and expedited. Thank you very much, Mr. Chairman.
Thank you so much. And I can share you my journey and emotions with CON. And since 2019, every year I would put in a bill saying that we should eliminate CON. But then I saw that some of the bigger hospitals were taking services away from parts of our communities across the state. And the CON was not stopping them. And I said, well, we need the CON to stop them from leaving the place. And it's almost like the CON has not necessarily worked the way we wanted to. It's been working the opposite direction. So we want something to stay, they don't do anything. And when we want something to come, the CON is blocking that from coming. So and then I put in bills to say, for cardiac catheterizations, there should be no CON because we need that across in a timely fashion across the state, and also for behavioral health and rehabilitation for mental health and substance use, there should be no CON. And so we've been looking at how the CON would be reflective of the community needs. And then I think that's the challenge and frustration many of us are facing with the CON, because it almost appears to be counter to what collectively we have intuitive feelings about, or the community needs are. So that's why, yeah, you're right. We'll have to have a conversation, and we'll have to have a session around that, and informational hearing, if you will. So I agree with you. Let's work on this after the session. Thank you.
Thank you. Thank you, Senator Anwar. Senator Gordon.
Thank you, Madam Chair. I won't belabor the point of CON. On one hand, I do share the thinking, why do we need it? On the other hand, yes, I would like to see OHS, if it now has better staffing, do a better job dealing with what happens with consolidation of healthcare, where we do lose services, especially in rural parts of the state. Sometimes we lose them without even a CON process happening. And I think to its discredit, I don't think the CON process has done that justice, trying to rectify the situation and hold systems accountable. On the other hand, I'm all for trying to streamline things, but part of that is making certain that there's a defined process and that it's held to. If there's timelines, then OHS should follow that. And hopefully they're going to be in a better situation to do that. One thing we just need to be careful of is if we're looking to streamline processes, for example, hospitals wanting to put in certain radiology services or expand it, and I did read through the CHA testimony, we got to be careful that that consolidation of the big systems don't crowd out or move out a lot of private practice entities, including private practice radiology centers, who do provide a good service to people in the state. So I think it's a balancing act, and we want to make certain we talk with OHS about how we balance that. Thank you.
Thank you, Senator Gordon. Balancing act is probably a key term in all of this, for sure. Representative Claritas Tetria.
Thank you, Madam Chair. And just to reiterate what everybody else said, I think it's important to really dig deep into the CON process. We need to streamline the process. We need to get the answers that everybody's been asking for many years. So I hope this bill goes through, and I have no further questions, Madam Chair.
Thank you, Representative Claritas Tetria. Representative McCarty.
Thank you very much. Just very quickly, I just wanted to voice how much I appreciated Senator Anwar's comments, because I do think as this process goes forward, that emphasis should be made that some of these facilities really should be exempt from the process when we're looking at substance use disorder facilities, that we need to expedite that and move those as quickly as possible. So I really appreciated your comments looking at community-based needs. Thank you.
Thank you, Representative McCarty. I think this conversation reflects the conundrum that we as leaders had, and why you see the bill as it is, because it recognizes that we need to have a conversation, and also respects that with some of our focus on workforce and opioids and a number of other issues in this session, we are going to have to take that time to really dive in. So I look forward very much to those conversations during the rest of this session and through the off session, together with other committees as well, so that we take advantage of all the work that has been done and bring it to bear on what we need going forward. Any further discussion? Representative Claritas Tetria.
Madam Chair, I'd like to put this item on the consent calendar.
Seeing and hearing no objection, this item will be moved to consent. That is House Bill number 6894. Moving on to item 14, House Bill number 6913. This is an act concerning opioids. This is a JFS to the floor, LCO 6388. May I have a motion?
So moved.
Moved by Senator Anwar, seconded by Representative Steinberg. Senator Anwar.
Thank you, Madam Co-Chair. This is another bill you probably heard earlier in Senate Bill 9 about some of the work on the opioids. This is another part of the bill. This is about opioid use disorder prevention and treatment. This is talks about a follow plan where substance abuse treatment facilities to retain the patient's record and have a contact or attempt to the contact every 4 months for 1 year. This because people fall through the cracks, and this is going to be one of the ways to have the facilities stay in touch with that the individual who is had experienced substance use disorder or opioid use disorder. The second part, section talks about the higher education facilities having opioid antagonist availability in the campus, and keep a track of that on a regular basis. But first update on January 1st, 2024 to report to the Public Health and Higher Education and Employment Advancement Committees on the implementation of its policy. Section 3 requires DMIS by January 1st, 2024 in collaboration with DPH to create a pilot program where licensed healthcare providers provide prescription digital therapeutics to patients with opioids or other substance use disorders to manage or treat it. And Section 4, DMIS report to the Public Health Committee January 1st, 2025 on the pilot program and any recommendations to continue to expand it. And Section 5 prohibits practitioners authorized to prescribe controlled substances, example methadone, and dispense them for patient treatment from a mobile unit from doing so within 500 feet of an elementary or secondary school, childcare center, playground, or public park, except for private residence where the controlled substance is dispensed inside the residence. Section 6 onwards till the Section 12, they are very specific recommendations. This is something that was somewhat of a blind spot in our state about a few years ago. As the opioid use has increased significantly in our state, what has happened is that innocent little children, infants, are dying from opioid that's been lying around in some of the homes. And these were all preventable deaths. Some of these deaths have come to our light after DCF has explored them in Office of Health Strategies. And recently, Office of Health Strategies had a report that came out assessing some of the issues of children dying from opioids. So this is our bill is going to try to assess that. We are looking at ways to be able to address this. One of them is to have DMIS, DCF, and DSS work collaboratively to look at the child caregivers and then make sure that they are not at a high risk or are in a situation where they can, if their use of substance and implement a program to prevent that impacting the children, and then give us a report by January 1st, 2024. Another part is to look at DMIS and DSS in collaboration with Office of Early Childhood to create a plan to allow parents in substance use disorder treatment to qualify the childcare supports and subsidies, and a report to Human Services and Public Health Committee by January 1st, 2024. So we are generating a number of reports to look at the total challenges that we have around this area, but also putting it collaboratively with our committee, with other committees of cognizance, and require DMIS, Department of Housing, and DSS to create a plan to ensure pregnant and parenting persons with substance use disorders have access to supportive housing. And report to the plan to the Housing, Public Health, and Social Services Committee. Again, also another part requires the DMIS and DSS and DCF to develop a plan to appropriate treatment for substance use disorder, because if the appropriate treatment is used, the chances of the child being removed from the family would reduce significantly if the appropriate treatments are in place. And then look at collaboration with DMIS, DCF, and DSS to existing substance use disorder treatment service for pregnant and parenting persons is part of the bill as well. This is again looking at opioid settlement fund to be considered for identifying support, but we are adding 2 more individuals in the opioid settlement fund advisory committee. The 2 individuals would be with the background of supporting infants and children. The fact that I said this was a blind spot illustrates the point when we made the opioid settlement fund advisory committee, we did not have anybody with background for children and infant health. And now we are actually adding more individuals to that committee to make sure that we address that aspect as well. So it's a pretty important bill, considering that we are taking care of some of the needs that are necessary. And I'll stop over here, and I'm sure there are going to be some questions or comments. Thank you, Madam Co-Chair.
Thank you very much, and we appreciate the work of the Office of the Child Advocate and DCF and DEMIS and so many others who help us to make sure that we are properly preventing and saving lives. Questions or comments? Representative McCarty.
Thank you very much for the recognition. I would just like to say how important I think this bill is. And I really want to recognize the efforts that have been made for the parents, the young parents and families that may be going through the substance use disorder treatment, how important it is to provide those supports for childcare. So the good half of the opiate bill, I think here, directs attention there. And if you read the testimony from the Office of Child Advocate, to realize that there were 8 infant deaths due to fentanyl intoxication over the last few years, I think we don't have to make too strong an argument of how important this really is, that we help those individuals that are trying to get treatment, help them with the childcare and the supports that they needed so that they can move on. Very grateful for that. And also I wanted to thank you for putting in the section on helping individuals that have gone through recovery in a treatment center, that we do have some follow-up to be sure that they're continuing with the program and how they are doing with the mental health issues and physical issues. I think that's excellent. I would suggest it be a little more often, but I appreciate what has been done so far. So I just wanted to know, I know there's a lot in the bill. I'm looking forward to seeing the plans coming out, how we can address the entire family. Thank you.
Thank you, Senator Amor. Would you like to- before I go to Representative Foster, I would just like to say, Representative McCarty, thank you for your proposal, which is included, and that's your work and your advocacy, which is so important. And for recognizing, oftentimes when we are treating, we treat people separately. We treat children, we treat parents, but they're a part of a family unit. And I think we know that there is a lot of work done in that way. I think this just underscores the need for that. So our systems are sometimes set up that way. So this is a systems approach. Representative Foster.
Thank you to the chairs for raising this and giving me the opportunity to speak on this bill. I think for many of us, and me even only having served one term prior to this, our work related to addressing opioid addiction has been long, and at times felt like we were not making progress at the pace of opioid abuse acceleration in our community. And so it feels to me that this year, between these two bills and a bill in human services on Medicaid funding for community health workers, that we might finally be in a position where we can be giving these facilities, the providers who are working with those with substance abuse disorder, the people who are suffering from substance abuse disorder, and those whose lives are impacted by substance abuse, access to the materials that they need. And so I just want to flag that there's a couple of opportunities in this bill that I think that this is a great companion bill to the human services efforts to see a community health worker funded. Folks who have substance abuse disorder need continuous engagement with skilled providers, skilled community members, folks who understand what they are going through. And that is a systematic approach to the healthcare system that I think requires making sure that a whole plethora of skilled providers have access to that person, and that person has access to providers. And so I think that this bill, particularly in the first section, offers a really good opportunity for collaboration. So I hope my colleagues, as they're supporting this legislation, they remember that we supported a pilot last year for what was more or less a community health worker under another name, we've seen positive outcomes from similar efforts and pilots. And so with these two pieces of legislation that hopefully we'll see broad bipartisan support for on here and on the floor of both of our chambers, that also that companion bill, which I don't know if we were considering it a companion bill, but in my mind, they are simpatico. So they're going together, that we can really make meaningful difference in addressing those with addiction. So I'm grateful to the work that's in this bill, and I'm very happy with the way it's come forward.
Thank you, Representative Foster. Representative Clara DeStitria. Oh, Senator Summers. Okay, Representative Clara DeStitria.
Thank you, Madam Chair. I'd like to put this item on consent.
Before we do that, Senator Anwar.
Thank you. I agree with consent. I just wanted to make a quick comment. One part of this bill, item number 5, which is talking about the distance from the elementary school and childcare and playgrounds and public parks and private residence. I just want to mention that we have heard, I've heard from a number of people who are in the harm reduction arena about their concerns about it. Their concern is that it is not going to get to some of the people who need the help. And I just also heard that this may be against the ADA rule. So I just wanted to mention that in the conversation, that this may be an area that we will work on a little bit more because of the ADA compliance, but also because of literally most of the harm reduction experts in our state who are talking about concerns around this part. That's just an interesting part. Thank you.
Thank you, Senator Anwar. Rep. Clara DeStitria. Can we go back to you?
Thank you, Madam Chair. I'd like to put this item on consent.
Thank you very much. Seeing and hearing no objection, this item, which is House Bill number 6913, will be moved to our consent calendar. Moving on to item 15, this is House Bill number 6914, an act concerning the use of funds in the opioid and tobacco settlement funds and funds received by the state as part of any settlement agreement with the manufacturer of electronic nicotine delivery system and vapor products. That's a JFS to the floor, LCO 6390, moved by Senator Summers. Is there a second? Seconded by Representative Clara DeStitria. The JFS language changes the amount that of the disbursement from the settlement fund to 22.7 million, which would be consistent with what we passed out previously. That's the minimum CDC recommendation. The language also assures that we're looking at all combustible, non-combustible electronic and synthetic tobacco and nicotine products, so that we're sure that all tobacco and nicotine are included. It gives priority to the prevention of initial nicotine use and eliminating exposure to secondhand smoke. And it also looks at best practices. It requires municipalities to annually report to the Opioid Settlement Advisory Committee on its expenditure, and the committee has to publish the report on its website. Is there discussion on this item? Representative Clara DeStitria.
Thank you, Madam Chair. I'd like to put this item on consent.
Seeing and hearing no objection, this item, which is House Bill number 6914, will be moved to our consent calendar. Bless you. Next on the agenda, item 16, House Bill number 6915, an act concerning cannabis use prevention efforts related to youth. This is a JFS to the floor, LCO 6393. Is there a motion?
So moved.
Moved by Senator Anwar and seconded by Senator Summers. The S language on this bill would simply change the percentages for the Prevention Recovery Services Fund. We heard concerns from the Social Equity Council, so the move is to move those funds to be taken from the general fund into that Prevention and Services Recovery Fund. It also says that those funds may be used for youth cannabis prevention by youth service bureaus, regional behavioral health action organizations, or local advisory councils. And the bill also requires the development of a public awareness campaign on the mental and physical health risks of youth cannabis use and cannabis use during pregnancy. Is there discussion on this item? Representative DiCaprio.
Thank you, Madam Chair. Just regarding moving this funding to the general fund for aspects of this initiative. I serve on the Approps Committee, and I think maybe some in the room also. We do have concerns in appropriations of that committee as far as initiatives with cannabis, and I'm all about prevention, childhood prevention. But there is a concern with the funding that we have a cannabis revenue stream, and that's something we think these kind of programs should come out of that funding. So there is that concern. So if I can suggest that if that's possible to do that. Thank you.
I thank you very much for your remarks. When the cannabis bill passed, there was a certain percentage of funding that was to go to prevention, a certain percentage to the general fund, and a certain percentage to the Social Equity Council. This bill seeks to put additional funding towards prevention. It no longer, as in the original bill, would take away any of those, for the percentage of funds going to the Social Equity Council. It would take away some of the cannabis revenue that goes to the general fund and then move it into prevention. I can see that there may be some who might be concerned about the loss of revenue to the general fund, but the goal is to put more dollars into addressing specifically the issue of youth prevention and the use and the impacts to those who are pregnant. Representative Mara.
Thank you, Madam Chair. And just a clarification, because there's if a municipality opens up a cannabis retail store, they get a percentage of funds. Is this going to then come out of the stream that would go to their funds then?
Thank you for the clarification, and the answer is no. This is the state revenue general fund, so the municipal option is a different stream, and that would continue to go directly to the municipality.
Okay, thank you.
Thank you. Is there any further discussion on the item? Seeing and hearing none, Madam Administrator, would you kindly call the roll?
Senator Anwar,
Madam Administrator, am I allowed to say, hang on 1 second? Is it
Sure.
too? I'm looking to our LCO attorneys. Are we okay? Can we, all right, I'm gonna go and. We are on number 16.
Never mind, sorry.
Okay. Thanks for the pause. Madam Administrator, I'm going to say again, would you kindly call the roll?
Senator Anwar,
Thank you. It gave me more time to think about the vote. Senator Anwar votes yes.
Representative McCarthy Vahey,
Representative McCarthy Vahey votes yes.
Senator Kushner,
Senator Kushner votes yes.
Senator Mark, Senator Summers,
Senator Summers votes yes.
Representative Clarice Detrier,
Representative Clarice Detrier votes yes.
Representative Belton, Representative Burgess Givallo, Senator Cabrera, Representative Carpino, Representative Cook,
Cook votes yes.
Representative Dauphiné,
Rep. Daphne votes yes.
Rep. Dauphiné, I did not see you on screen, please.
Rep. Daphne votes yes.
Thank you. Representative DiCaprio,
Representative DiCaprio votes yes with my concern. Thank you.
Representative D'Amico,
D'Amico votes yes.
Representative Denning,
Representative Denning says yes.
Representative Elliott, Representative Foster,
Rep. Foster votes yes.
Representative Django,
Rep. Jenga votes yes.
Senator Gordon,
Senator Gordon votes yes.
Representative Cavros DeGraw.
Cavros DeGraw votes yes.
I did not see you on screen, I'm sorry.
Cavros DeGraw votes yes.
Thank you very much. Representative Smith,
Representative Kit votes yes.
Representative Kennedy,
Kennedy votes yes.
Representative Linehan,
Linehan votes yes.
Representative Mara,
Representative Mara votes yes.
Representative McCarthy,
Representative McCarty votes yes.
Representative Palm,
Palm votes yes.
Representative Perrello, Representative Raider,
Representative Raider votes yes.
Senator Rahman,
Senator Rahman vote yes.
Representative Reddington Hughes,
Reddington Hughes votes yes.
Representative Ryan,
Representative Ryan votes yes.
Senator Slack,
Senator Slack votes yes.
Representative Steinberg,
Representative Steinberg votes yes.
Representative Welander,
Representative Welander votes yes.
Representative Zupkis, Senator Marks, Representative Belton, Representative Berger Javallo,
Berger Javallo votes yes.
Senator Cabrera, Representative Carpino, Representative Elliott, Representative Gilchrist, Representative Perrello. Thank you, Madam Chair.
Madam Clerk, may I vote, please? I was sneezing and didn't hear my name.
Representative Zupkis,
Representative Zupkus votes yes. Thank you.
thank you.
I hope you're not allergic to us at this point, Representative Zupkis. Thank you so much, Madam Administrator. We have reached our final vote for the day, which is our consent calendar. These are the following items: Senate Bill number 1229, an act concerning emergency medical services, JF. Item number 13, House Bill 6894, an act concerning certificates of need, JF. Item number 14, House Bill 6913, an act concerning opioids, JFS, LCO 6388. And item 15, House Bill number 6914, an act concerning the use of funds in the opioid and tobacco settlement funds and funds received by the state as part of any settlement agreement with the manufacturer of electronic nicotine delivery system and vapor products, JFS LCO 6390. And we've already had a motion and a second on the consent calendar. And with that, Madam Administrator, would you kindly call the roll?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy Vehy,
Representative McCarthy Vehy votes yes.
Senator Kushner,
Senator Kushner votes yes.
Senator Marks, Senator Summers, Representative Clarice Beecher,
Senator Summers votes yes.
thank you. Representative Clarice Beecher,
Representative Claire DeStitria votes yes.
Representative Belton, Representative Berger Javallo,
Berger Javallo votes yes.
Senator Cabrera, Representative Cook,
Cook votes yes.
Representative Carpino, Representative Dauphiné,
Rep. Dauphiné votes yes.
Representative DiCaprio,
Representative DiCaprio votes yes.
Representative D'Amico,
D'Amico votes yes.
Representative Denning,
Representative Denning votes yes.
Representative Elliott, Representative Foster,
Rep. Foster votes yes.
Representative Django,
Representative Jenga votes yes.
Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Gordon,
Senator Gordon votes yes.
Representative Cavus DeGraw,
Cavros DeGraw votes yes.
Representative Kit,
Representative Kit votes yes.
Representative Kennedy,
Kennedy votes yes.
Representative Linehan,
Representative Linehan votes yes.
Representative Mara,
Representative Mara votes yes.
Representative McCarthy,
Representative McCarty votes yes.
Representative Palm,
Palm votes yes.
Representative Perillo,
Perillo votes yes.
Representative Raider,
Representative Raider votes yes.
Senator Rahman,
You, me? Senator Rahman vote yes.
Representative Reddington Hughes,
Representative Reddington Hughes votes yes.
Representative Ryan,
Representative Ryan votes yes.
Senator Slack,
Senator Slack votes yes.
Representative Steinberg,
Representative Steinberg votes yes.
Representative Welander,
Representative Welander votes yes.
Representative Zupkis,
Zupkis.
Representative Zupkis votes yes.
Senator Mark,
Yay.
Representative Belton, Senator Cabrera, Representative Carpino, Representative Elliott. Thank you, Madam Chair.
For the last time this session, thank you, Madam Administrator, for everything. The votes will be held open until 5:30 today. And those of you who are not able to catch our clerk here in the public meeting area can go up to the public health area to vote. And of course, people can also vote on Zoom. I want to add just one final thanks. I'm just going to echo the beginning. It's an honor to work with Senator Anwar, Senator Summers, and Rep. Claritas Detria. It truly is. It's been a tremendous team effort. We encourage you to remain in contact with us. And I will just give one more thanks, and that is a thanks to the family members of every person sitting here, whether you are in the audience or on Zoom or sitting here around this circle. Our family members, especially for those of us on this side of the table, so to speak, they don't run for office, but they certainly participate and sacrifice. So we thank our family members, and we, again, Senator Anwar and I thank every single one of you for your participation, your guidance, and your support, especially our team behind the scenes. And with that, we are in recess until 5:30. Thank you, everyone.
Madam Administrator, can I register a vote?
Do you know which bill you're missing?
Excuse me?
Do you know which bill you're missing?
I believe it was number 12, HB 6836.
6836, okay. Representative Kit, how would you like to vote on House Bill 6836?
Representative Kit votes yes.
Thank you.
I believe that's the only one I missed, correct?
Okay, if you're missing any other ones, that we'll reach out to you.
Thank you.
Thank you. Will be holding both open until 5 o'clock. It was 2,500. It will be in Zoom. The Judiciary Committee is open. 5 o'clock. 2,500 or via Zoom. Representative Cabris DeGraw, are you ready?
I am when you are. I think it's just the first one.
The first one?
I think so.
Senate Bill 9, an act concerning health and wellness for Connecticut residents. How would you like to vote?
Yes.
Thank you.
I don't think there's anything else.
I'm taking a quick look on the outside of my phone.
Okay. Thank you.
I think you're correct.
Okay, thank you so
I
much.
don't think you're missing anything else.
Okay, great, thank you.
You're
Have a
welcome.
good day.
Same to you. Thanks. Senator Slot, you have quite a few. Can I take Representative Lenahan first, please?
Sure.
Representative Lenahan, do you know which vote you're missing?
I don't, Madam Administrator, I'm sorry. If it helps, I do all of my homework and I know that I was a yes on everything today.
Okay, you're missing number 5.
Excellent.
No.
Representative Linehan votes yes.
Thank you.
Thank you. Is that all?
No, let me check to see if you're missing
Okay.
anything. I have a constitution to vote on the exam. Okay. Thank you, Representative Lenahan. You're all
Thank
set.
you. Have a great day.
You're welcome. Bye-bye. Representative Perrella, I think you're missing maybe the last couple bills.
That's right, Bev, just the last few. Maybe you want to start with 10 just to be on the safe side.
I have you voting on 10. You're missing number 11.
That's a yes.
Thank you. You're missing number 16.
Yes.
You're missing number 12.
That's also a yes, Bev.
You're all set, Jason.
Thank you.
You're welcome. Senator Slack,
Mm-hmm.
give me 1 second, please. 3, 5. How are you? I'm well, thank you. I think I missed one of them. Okay, I'm going to take Senator Stubb, then I have to take Representative Elliott. Can I come get you in your office? when I'm done?
gonna be there doing.
Okay, I'll come and grab you then. Senator Slav, are you ready?
Yes.
Okay, item number 1, Senate Bill 9, how would you like to vote?
Yes.
Item number 2,
Yes. Didn't mean to cut you off, sorry.
That's okay. Item number 3,
Yes.
item number 4,
Yes.
number 5,
Yes.
number 6,
Yes.
number 8,
Yes.
number 9.
Yes.
Oh, you had already voted on 9, I'm sorry.
Sorry.
Number, you voted on 10.
Yeah. Yeah. Then I was there through the remainder.
Yeah, I'm just making sure so we don't have to track you down.
Yep.
And consent is item number, you voted on consent.
Yeah.
You're all set.
Okay. Thanks so much. Take care.
Yep.
Ready?
Yep.
You're ready.
I am ready. Can we vote on consent first, please? Let me see if I can do this. Okay, items number 7, 13, 14, and 16 are on consent. How would you like to vote?
Yes.
You want to do the agenda? Okay.
You did.
Okay. Item number item number 1, how would you like to vote?
Yeah.
Item number 2, how would you like to vote?
Yes.
Number 3,
Yes.
item number 4,
Yes.
number 5,
Yes.
number 6,
Yes.
number 8,
Yes.
number 9,
Yes.
number 10,
Yes.
number 11,
Yes.
12,
Yes.
and 16.
Yes.
Thank you very much. You have a good afternoon. Bye. Well, you're leaving too? It's Senate Bill 1112, an act establishing a mental health crisis center pilot program. How would you like to vote?
Senator Gordon votes yes.
Thank you very much. Have a great evening.
Thank you, you too.
Bye bye, sweetheart. You're a rock star. Oh, Kathleen. Just give it to them if they come in. Yeah, who cares? What are you gonna say there? They're gonna, no, they're gonna have to.
And so I just.
Who wanted it? She's annoying as hell, no.
No, she is, but Kate said, no, it's an internal document.
No, it's a, one is job written.
No, that's
Okay.
right. Okay, I just.
Thank you, Senator. Same to you.
Okay, so well, I'm gonna put all the extra ones in here.
Okay, are you taking How is the baby, John Michael? Hi, Jillian. Hey, it's gonna take over in few minutes.
Oh, I'm muted and I yelled and screamed and made my dogs go crazy. Hi, John Michael.
Hi, Jillian. Hi,
How's it
Bev.
going?
We're doing good. How are you?
Hey, good. Congratulations. I'm so happy
Thank
for
you.
you.
Thank you.
He's a colleague of mine. He had a baby. Here's my daughter.
Oh, hi.
And I made my dogs go crazy. Sorry, everybody. All right, sorry.
It is setting up. So she'll be on short.
Okay.
Thank you.
Ah, how many days old?
Oh, is he 11 days old?
Not sleeping through the night yet, of course, right?
No, but he's a pretty good sleeper.
Good.
We're really lucky. So we get, a couple hours stretches at a time.
Awesome.
And he's just a happy little sweet man.
Yay. All right, I'm forgetting your wife's name and I don't want to call her your wife. So what's your wife's?
Joyce.
Joyce. How's she doing?
Yeah, she's great.
Good.
Yeah, she's recovering well and just such a good mama.
Yay. I'm so happy for you.
Yeah, thanks. How are you doing? How's
So
you had
Brooklyn.
a big couple days on human services, huh?
Yeah. So it's been good, just really busy, fine. And then today was huge on public health, but I was out and about. It's also, this week is, we're giving our final recommendations for appropriations.
Oh, wow.
So yeah, it's good. Oh, I'm so happy for you.
I'm conscious that we're on a publicly recorded meeting, but I'd be curious sometime to know how you're liking the new job.
Yeah, we should. Let's off of a public forum. Let's have coffee.
Hi, Kate.
And I totally forgot it was public, and I love that I've now just screamed like a little.
Close the door.
That's 5 minutes. I have the dog.
Jillian, you go first.
Hi, Kate. I missed every vote except for the consent calendar.
Okay, so let me, when I come upstairs, I have to shut my whole computer down and then reboot because of the internet situation. So let me, seconds, and I'll get you. Okay, so Representative Gilchrist. Okay. Can you hear me?
Yes, I can.
Okay, so item number 1, Senate Bill 9, how do you vote?
Representative Gilchrist votes yes.
Item number 2, Senate Bill 1067, how do you vote?
Representative Gilchrist votes yes.
Item number 3, Senate Bill 1073, how do you vote?
Representative Gilchrist votes yes.
Item number 4, and there was a friendly amendment on item number 4. And it changed the composition of the speakers of who's assigning the members. It'll now be the speaker and the pro tem do 1 appointment each, and each of the chairs, the 2 chairs and the 2 rankings do 1 appointment each.
Okay.
It was a voice vote. It passed. It was
Okay, great. Representative Gilchrist votes yes.
all right. And item number 5, Senate Bill 1211.
Representative Gilchrist votes yes.
And Senate Bill 6, I'm sorry, item number 6, Senate Bill 1228.
Representative Gilchrist votes yes.
Number 7 was on a consent calendar. Number 8, House Bill 6602.
Representative Gilchrist votes yes.
And number 9, House Bill 6733.
Representative Gilchrist votes yes.
And number 10, House Bill 6740.
Representative Gilchrist votes yes.
All right. And number 11, House Bill 6835.
Representative Gilchrist votes yes.
All right. And number 12, House Bill 6836.
Representative Gilchrist votes yes.
Okay. And 13, 14, and 15 were also on a consent calendar. Item number 16, House Bill 6915.
Representative Gilchrist votes yes.
Okay, and then I have the consent calendar from you.
Awesome.
Yep, so you're all set.
All right, thanks, Kate. Have a good
Thank
one.
You too, bye.
Bye.
Representative Parker, are you ready? Are
Yes,
you
ma'am.
The next contestant. I'm on camera, I shouldn't say this. Ready to come on down? Next. But there's a toll you have to pay.
Oh God.
I
How
need to
much?
say baby feet. No heads on camera, just feet. Oh gosh. Oh gosh. Oh gosh. I just
Oh my goodness.
right? Oh, I remember those onesie days. You just want to squeeze the little soft bodies.
We really do.
Okay, Representative Parker, we'll start with item number 1, Senate Bill 9. How do you vote?
Yes.
Okay. Item number 2, Senate Bill 1067. How do you vote?
Yes.
Okay. Item number 3, Senate Bill 1073. How do you vote?
Yes.
Okay. Item number 4, Senate Bill 1210. How do you vote?
Yes.
Okay. Item number 5, Senate Bill 1211.
Yes.
Okay. Item number 6, Senate Bill 1228. How do you vote?
Yes.
Item 7 was on a consent calendar. Item number 8, House Bill 6602.
Yes.
And item 9, House Bill 6733.
Yes.
Item 10, House Bill 6740.
Yes.
Item number 11, House Bill 6835.
Yes.
Item number 12, House Bill 6836.
Yes.
Okay, 13 through 15 are on a consent calendar.
Right.
Item number 16, House Bill 6915. How do you vote?
Yes.
Okay, and the consent calendar, which has items number 7, 13, 14, and 15. How do you vote?
Yes.
Okay. Rep Parker, you are all set. Thank you so much.
Thank you, Kate.
Okay. I hope you get some
Bye.
sleep. Bye.
We will. See ya.
Bye. And Rep Belton, is that you?
Yes, I'm here.
Awesome. I have to change your name so that it's official. There he is. Okay. So let me see. Okay. Okay, we're gonna start with item number 2, Senate Bill 1067.
Yes.
And item number 3, Senate Bill 1073. How do you vote?
Yes.
And item number 4, which had a friendly amendment added, and it changed the who gets to assign the members. It's now the Speaker of the House and the Senate President have 1 appointment each, and then the 2 chairs and 2 rankings also have 1 appointment each, as opposed to, I think it was just the chairs who had the prior. So that was it. And how do you vote on that?
Yes.
Thank you. And I thought 5. I stepped out on vote number 6 and haven't been able to compare my notes with Bev yet. Can you tell me how you voted on number 6, item number 6?
Yes.
Okay. Item 7 was on the consent calendar. I think 13 through 15 were also on the consent calendar. And then item number 16, House Bill 6915. How do you vote?
Yes.
Okay, and then the consent calendar has items number 7, 13, 14, and 15. How do you vote?
Yes.
Well, thank you, Bill. You're all set.
All right. Thank you. Have a good evening.
Or evening.
Yes.
Whole day is gone. Thanks so much.
Take care. Bye-bye.
Hello, Senator Marks. Hi, Senator Marks, can you hear me? You're muted.
Hi.
Hi, how are you?
Good.
Okay, let's see here. Okay, I want to start with item number 3, Senate Bill 1073. And how do you vote?
Yes.
All right, and item number 4, there was a friendly amendment that would, and it updated who did the appointments. So now it is the Speaker of the House and the Senate Pro Tem have 1 appointment each, and then the 2 chairs and the 2 rankings also have 1 appointment each. And that passed on a voice vote. I cannot speak. And how do you vote on the bill?
Yes.
Okay. Here. I stepped out for item number 6, and I haven't been able to compare my votes with Bev. Do you know how you voted on
Which
item
one
number?
is that?
That is Senate Bill 1228.
What's the name? What's the name?
Healthcare workforce.
I think I was there, but I'm not sure. So yes.
Yes, okay. And then item number 7 was on the consent calendar. Item number 10, House Bill 6740, which is an act concerning hospital financial policies.
Yes.
And then item number 11, House Bill 6835, an act concerning various revisions to the public health statutes.
Yes.
And then item number 12, House Bill 6836, an act concerning blood plasma collection.
Yes.
Okay, 13, 14, and 15 were also on the consent calendar. And then item number 16, House Bill 6915. That is an act concerning cannabis use prevention efforts related to youth.
Yes.
Okay. And then on our consent calendar, we have items number 7, 13, 14, and 15.
Yes.
Okay, you're all set, Senator Marks. Thank you so much.
Hey, thank you. Have a good night.
You too. Bye-bye.
Bye.
Hello, Senator Cabrera. How are you?
Hi, Kate. How are you?
Good, good. Okay, I'll get to this very quickly.
Okay.
So start with item number 1, Senate Bill 9.
Senator Cabrera votes yes.
And then item number 2, Senate Bill 1067.
Senator Cabrera votes yes.
Item number 3, Senate Bill 1073.
Senator Cabrera votes yes.
And item number 4, Senate Bill 1210.
Senator Cabrera votes yes.
Item number 5, Senate Bill 1211.
Senator Cabrera votes yes.
And item number 6, Senate Bill 1228.
Senator Cabrera votes yes.
Item number 7 was on the consent calendar. Item number 8, House Bill 6602.
Senator Cabrera votes yes.
And item number 9, House Bill 6733.
Can you hear me?
Yes, item number 9, House Bill 6733.
Senator Cabrera votes yes.
And item number 10, House Bill 6740.
Senator Cabrera votes yes.
Item number 11, House Bill 6835.
Senator Cabrera votes yes.
Item number 12, House Bill 6836.
Senator Cabrera votes yes.
Items 13 through 15 were also on a consent calendar. Item number 16, House Bill 6915.
Senator Cabrera votes yes.
Okay, and the consent calendar, which contains items number 7, 13, 14, and 15. How do you vote?
Senator Cabrera votes yes.
Okay, excellent. You're all set. Thank you so much.
Thank you so much. Have a great day.
Anytime. It's Monday.
That's right.
I told people
Take
the
care.
same thing too. I was like, oh, it's Friday. We're gonna go. Yeah, no, we're just getting started.
I know. A few more days. All right. Take care.
Thanks so much. Bye. Representative Gervalo.
Hey there, I will take you off or put the screen on in just 10 seconds.
Hi.
Hi there.
Sorry about this. Sorry.
We're all good.
Item number 4, Senate Bill 1210. It has a friendly amendment that updated the composition of who appoints the appointees.
Right.
And there was a voice vote on that. And
Yeah.
how do you vote on Senate Bill 1210?
Yes.
Excellent. Okay. Let me just, okay. And then I just want to double check. Item number 6, Senate Bill 1228. We have that one. Okay. You're all set. Thank you so much. I appreciate
Terrific.
it.
Thank you. No worries.
Get back in GAE quick.
Thank you. All right.
Bye.
Bye.
Okay. Senator Rahman, on item number 1, Senate Bill 9, how do you vote?
Yes.
Yeah. Item number 2, Senate Bill 1067, how do you vote?
Yes.
Okay. Item number 3, Senate Bill 1073, how do you vote?
Yes.
Item number 4, Senate Bill 1210.
Yes.
I'm sorry?
Yeah.
Yeah, everything. Item number 5, Senate Bill 1211, how do you vote?
Yes.
Okay. Item number 6, Senate Bill 1228, how do you vote?
Yes.
Item number 8, House Bill 6602, how do you vote?
Yes.
Okay. Item number 9, House Bill 6733, how do you vote?
Yes.
Yes. Item number 10, House Bill 6740, how do you vote?
Yes.
Senator Rahman votes yes. Okay. Item number 11, House Bill 6835, how do you vote?
Yes.
Item number 12, House Bill 6836, how do you vote?
Yes.
And then you're all set.
I'm all set.
You're all set. Thank you so much. I
You're
appreciate
very
it.
welcome.
Have you have a good afternoon, evening.
You're still here.